Good morning. I will now call into session this meeting of the Moore County Board of Education. We are in session for both a work session and a special called meeting. It is Monday, November 1st, 2021. I'll note that all board members except Ms. Caldwell are present. She has sent a message that she is behind a school bus of all things, but will be here shortly. So we will go ahead and proceed. At this time, I'll entertain a motion to approve the agenda as presented.
So moved.
Second.
All those in favor?
Aye.
Opposed? Motion carries 6-0. I now invite you to join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I ask Vice Chair Thompson to lead us in a moment of silence.
Good morning. We recently lost former student within our county, so let's keep the family in our thoughts in this time. Thank you.
Thank you. All right, we will move on to pending action and discussion. Dr. Grimacy, our first item up is the COVID-19 update.
If I could, Madam Chair, before we get started, just note that is a housekeeping item, that we have a hard stop at noon today for closed session and lunch. So wherever we're at that point, if we get ahead of schedule before closed session, the board can certainly move on to reports, information, and discussion. But since our board action is somewhat dependent on the board's access to legal counsel during closed session, we'll skip over closed session and board action, go to reports, information, discussion. That's if we get ahead of schedule. If we're not ahead of schedule, then we'll stop wherever we are in pending action and go to lunch and closed session at that point.
Thank
Everybody
you.
okay with that? Okay.
Yes, sir.
And so with that then, I'll turn it over to Dr. Locklear, who's got some guests with him today for our
sir.
COVID-19 update and recommendation regarding the mask requirement. Dr. Locklear.
Thank you, Dr. Grimacy. Good morning, Madam Chair, board members. As Dr. Grimacy noted, I do have some updates today on the COVID-19 management update, and then information around our recommendation for masking for the next month. I'd also like to welcome Mr. Whitman from the Moore County Health Department, Ms. Fraley, and Mr. Gardner, who are here also to share a little information and to be available for questions. And I'll turn it over to them about midpoint through the presentation. So again, I want to thank them for their willingness to come today and be part of this. As always, we like to start our presentation off with thanking our partners in the community who continue to partner with us. We're in our 20th month of managing the pandemic. Sometimes hard to imagine, but we're now 20 months into this. I want to continue to thank our partnership on a daily basis with the Moore County Health Department. We continue to be members of the ABC Science Collaborative and appreciate their partnership and research they continue to do on this. The First Health of the Carolinas, of course, and of course our parents, students, and staff and the community who continue to be extremely supportive, patient, have shown grace. Our staff have continued to do heroic work every day as we continue to manage this pandemic, and we greatly appreciate their efforts. The outline of the presentation this morning, as we've seen for a few months, Dr. Powers and I, we've come to give you this presentation. Any updates that we have related to athletics, any updates around the Department of Health and Human Services guidance and North Carolina Strong Schools Toolkit. We are bringing some additional overview of the state COVID-19 testing program, which Dr. Powers shared information around a couple weeks ago in your work session. Highlight some information on that. I'll continue to talk about our quarantine management collaboration with the Moore County Health Department, and again, appreciate them being here today to share any information they'd like and answer questions. We'll talk a little bit about their guidance and the information we have around the Moore County community transmission and positivity rates, which is the metric that we're monitoring as we look at when we might recommend going mask optional. We'll look at our current COVID-19 metrics And again, our recommendation for face masking for the next month, which is required per law, that we look at that on a monthly basis. We're happy to say in athletics, there's really no new updates related to that, and we have no group quarantines. I think saw in Dr. Grimacey's update this morning that we're going into 3 weeks of not having a group quarantine, not having any students who are absent or staff who are absent as a result of group quarantine. That's very good news. That means our data is trending in the right direction, and we're happy to share that. As far as updates on COVID-19 restrictions, all the previous North Carolina Department of Health and Human Services guidance as part of the Strong Schools North Carolina Public Health Toolkit remains in place as of the last update we shared with you in October. They have added a frequently asked questions document related to K-12 schools, and face coverings. Will hit on a highlighted portion of that later before I turn it over to the health department, because it is connected somewhat to the letter Mr. Whitman shared with us last month. You may have seen, we noted this, I think a couple weeks ago, that we saw in the media that there may be new OSHA restrictions. They may begin to require employers with more than 100 or more employees to require vaccinations or have unvaccinated employees tested once per week. That may come from OSHA. We know once that does come out, if it does, there's several layers that it has to work through before it becomes a requirement here in the state. So that wouldn't be immediate if it was announced. But we feel like, because of our current plans to move forward with the COVID-19 testing program, we would have a system set up to accommodate that process if needed through the COVID-19 testing program that I'll talk a little bit more about here in a couple minutes. So again, as a service to our families and employees, we'll be offering the opportunity for testing at schools, and that's something that will help us be in a good position for that. Speaking of the state COVID-19 testing program, Dr. Powers shared some information related to that at the October 21st work session, special called meeting that you had. Again, some highlights related to that. Moore County Schools has elected to receive state funding to provide free, optional diagnostic testing to students and Moore County school employees at designated school sites. Currently, about 85% of the state school systems are participating in that opportunity. Parents must provide documented consent in order to have their child tested. No student will be tested without documented parental consent. Again, this is an optional opportunity. Funding allows for the purchase of supplies, materials, and additional nursing personnel to administer testing. The budget we're working towards is 14 additional nurses and 1 lead nurse. We're currently working through and have able to working to move forward with 9 nurses and 1 lead nurse currently is where we're moving forward. Information has been shared about this opportunity with parents and the opportunity to register and provide consent. And the goal is for the testing program to begin once we have final authorization from the Department of Health and Human Services. We've also created a frequently asked questions guide on the website that's been posted, I think, at the end of last week. So it's out there for our families and community who have questions related to that. And we continue to communicate daily with the Moore County Health Department. Dr. Powers, Ms. Stedman, our school nurses continue to communicate on a daily basis with the Moore County Health Department staff. We continue to be appreciative of that collaboration. We have a weekly meeting, formal meeting, each week with the Moore County Health Department, and the health department, and certainly they can respond to this as well, but they continue to plan to follow the guidance of the North Carolina Department of Health and Human Services Strong Schools Toolkit regarding COVID-19 management and in making quarantine-related decisions. I will note and point out to you the addition to the North Carolina Department of Health and Human Services Toolkit with the FAQ that they added last week related to face covering specifically. I want to highlight this statement because it connects to the guidance from the health department that Mr. Whitman shared with us last month, and now I'll hand it over to Mr. Whitman. Given that our student, again, this is from the North Carolina Department of Health and Human Services Strong Schools Toolkit FAQ, highlighting a statement from that was released last week. Given that our student population is largely not yet vaccinated, face coverings remain a critical tool for protecting children and keeping them safely in the classroom. NCDHHS recommends schools continue to implement a universal face covering requirement if they are located in a county with a high or substantial community transmission level. And you'll note the coloring of these words matches the tool that the state uses to identify that. When the community transmission levels decline to moderate or low levels for at least 7 consecutive days, school leaders can consider making face covering optional for vaccinated individuals. Face covering should continue to be required for all unvaccinated individuals until community transmission is at low levels, when masks could be optional for everyone. NCDHHS will continue to reevaluate the guidance as all school-age children become eligible for and get vaccinated. I will note we did discuss this with the health department last week, and I think we're both in agreement that when we become to a moderate level, that making face masks optional for those who are vaccinated and required for those who are not would be a very, very difficult administrative burden to manage. It is also our hope, and I think the health department's view, that we're very quickly trending to low levels. And that would not be a long period of time that we'd be sitting there trying to manage both at the same time. And because of that, it may not make sense administratively to look at that. But that's just a comment that something we discussed last week.
Just one thing I'd like to interject, and that is that if you did something like that, you would have half the children masked and half the children unmasked, and you would have two groups of children differing in their appearance. And that would be a tragedy, especially for those students who decided to not take the vaccine based upon religious reasons. So I want to emphasize that having certain groups of children masked and certain groups of children unmasked in a school would be tragic, and it would be just wrong.
So last month we shared a letter that Mr. Whitman had given us and recommended metrics for considering less strict control measures and quarantines and masking. We could pull that letter up. It's linked there. That would be helpful. And again, we're going to continue to monitor this data, but I think this is a good opportunity to turn it over to Mr. Whitman and his team, see if there's any information he wants to share, and then kind of pause and see if there's any questions for him and his team before we move forward with the remainder of the presentation. Mr. Whitman, thank you again for being here.
Thank you, Dr. Locklear. Actually, you covered it rather well. My letter of September the 30th, I recommended that the school administration and the school board not consider optional masking until the metrics both in the community and the school itself would get to going through the moderate to the low area. And since then, my September 30th letter, we got further guidance on the October 26th memorandum that you mentioned that said that if you got to the low level or moderate level, then you could consider masking of the unvaccinated and unmasking of the vaccinated. After giving that careful consideration and discussion with school administration, my recommendation is as follows: is that the good news is the benchmarks, the metrics we're looking at are quickly going this way. We have 3 holidays coming up. We've got Thanksgiving, we've got Christmas, Hanukkah, and Kwanzaa, and also we have New Year's. So those 3 major blocks of time, we can expect a possibility of some blips, some increase following those, immediately following those holidays. And so with that in mind, and the good news on the horizon that things are definitely trending in the right direction, I'd recommend that the school board consider looking at the benchmarks that are out there for low, which is number of cases per 100,000 persons in the past 7 days would be less than 10, and the percentage of possible tests during the past 7 days would be less than 5%. And I think that's the target that the state put up for testing was 5%. And I believe we're trending quickly in that direction. But we can't expect some, as I said, blips during the holidays. So I would suggest that the school administration and the school board, I think you folks are coming back, and Dr. Locklear and Dr. Grimacy mentioned the date of January the 10th. I think that's a good time to be looking at our community metrics and the school metrics and make a decision at that time. I do not recommend that to separate the population into schools. That would be extremely difficult to identify which students are vaccinated, which are unvaccinated. I think what we need to do, if we got in that situation, I believe it would create confusion at best, chaos most likely, and it also impacts on the quarantine period, whether masked or unmasked. And so I just recommend that we do it all at once. When the metrics get low, we just move to mask optional and don't look back. I think that once you go to mask optional, it's going to be very difficult to move back to mandating masks. So I would make sure that the metrics are in the low category, and that's a solid number. And I think that's all I've got on masking. I've got, if you, I can have Melissa Fraley is our Director of Nursing. Dr. Locklear, are there any questions or anything on quarantining?
Well, I'll see if the board has any follow-up on what you just said and any specific questions on quarantines. We took from staff, we do not, Mr. Wood.
Yes, okay, fine.
Okay, so are there questions for for Mr. Whitmer about, I'm sorry, we don't take questions from the audience, sir, but thank you. Mr. Hensley?
Thank you, Madam Chair. It's Mr. Whitman, right?
Yes, sir.
Mr. Whitman. Keep from knocking stuff over. So a couple questions. When was the last time Moore County was in the low category?
Matt's our statistician.
Summer, it was.
Hey, Matt, if you could pull the microphone over. Yeah.
Yeah. This is Matthew Garner. He's our.
Hey, Mr. Hensley, how you doing?
Educator and our public information officer. Keeps up with the statistics for our.
So roughly the last time that the county was within those parameters was around about, I would say, late June, early July.
So Moore County's been in the low category in the last 6 months.
Yes.
Okay, thank you. My other comments, I saw some disturbing language that's crept into our brief today, and specifically language that I've never seen Moore County Schools or the central office present. Specifically, it talked about the large majority of our children are not yet vaccinated. And then secondly, it talked about an upcoming OSHA requirement that companies with 100 or more employees would require mandatory testing. Setting aside for the fact that 19 states have filed lawsuits against the Biden administration for this OSHA rule, with more states expected to join, I'm interested in the Moore County Health Department's position on these two issues. So my first question, Mr. Whitman, is does the Moore County Health Department support mandatory vaccines at the workplace?
I support vaccination. The mandatory, I'm not so enamored with. But the more people are vaccinated, the better. One of the, we're right now experiencing the Delta virus, which is highly infectious, and it's going through our population rather rapidly. And that's one of the benefits. It's the other side of the coin. One side of the coin is it's sad that we have a virus that's going rapidly through our population. We even have breakthrough for vaccinated people, but the folks that are vaccinated usually have a mild case without a great deal of medical support, and they recover. The unvaccinated are the ones that are hospital stats that they furnish us, are the ones that are hospitalized or in ICU much more often than the vaccinated. The other side of the coin is once somebody has this disease, they have some natural immunity. So that's helping. Between the vaccinations and this disease, we're bringing our metrics down. As I said, I would prefer as many people as possible to be vaccinated, but I'm not a real fan of mandates.
Yeah, and I think just one follow-up on something you mentioned. I think there's a lot of frustration that the programs that have been coming from on high, so to speak, whether the state or federal government, don't recognize natural immunity when natural immunity exists. I mean, you want to deny science. Anyway, so thank you on that. I have two other questions on mention.
Let me
Yes, sir.
mention one thing. I'm also, as a public health officer for the county, that I follow the Centers for Disease Control and North Carolina Department of Public Health, their instructions. So if it comes down that they say this population or that population, it's mandated for vaccination, then I would have to enforce that or support that. But right now, it's recommended. It's not as far as our general population. The current administration, I know, are making mandates on different levels. So we just have to see what comes down.
So I assume it would be essentially the same answer for mandatory vaccination of our children, is if it was mandated by higher, then that would become the position of the Moore County Health Department?
Well, we've had mandated vaccines for children for a long time.
Correct.
And those are diseases that seriously affect children. I would prefer this one to be voluntary, with the parents making the choice. But again, it depends on what the CDC and North Carolina Department of Health and Human Services, what documents come down from them. But that's my personal preference.
Okay, and then one last question. Well, one kind of, it's a series of questions, but I'm sure you all are aware of the Moore County initiative to potentially, because I'm not sure it's settled yet, but potentially have COVID-19 testing at all of Moore County schools. You guys are aware of that, correct?
Yes.
Yeah, so I have two concerns about it. One is, to what end, and why are we doing this and spending millions of dollars regardless of the source? So that's my first question. And my second question is, what about the real risk of people sending sick children to our schools to get tested for COVID when we're trying to keep people who are infected with COVID out of our schools, why wouldn't we send them to a testing center away from our schools so that we don't get COVID in our schools and we don't end up with quarantines?
The state has made available, the ability through contractors for testing on school property. We also have, through the health department, an agreement with, Goshen Medical, Health, and we provide testing at no cost, twice a week at the, health department site centrally located here in the county. So, that's a second option that, parents have.
So
But,
this $1.4
I
million
can't-
dollar, I'm sorry, go ahead.
You'd have to discuss with your school administration. I'm sure that they, that the testing is not, is for children before they go, you know, if they're eligible for testing, that they would be tested before they got into the general population. But that testing is something that the federal government and the state government want to have available for parents that have children in school at no cost. And so I know that that's going to be available. And as I said, we also have available another option where they don't have to go on school property. They can come on at the health department and be tested twice a week.
And it's the health department's position that it poses that people sending people, I'm going to explain it a different way. So it's the position of the health department. Well, let me back up. People, if I'm a parent and I'm going to send my child to get tested for COVID, the assumption would be I think they have COVID, because why would I get my child tested if I didn't think they had COVID or were exposed to it? So to the layperson, it seems like sending people who might have, students who might have COVID to school to get tested for COVID would potentially expose other students to COVID, because, you know, in an ideal world, you know, the student goes in, they go to a separate line, they ride a separate bus, their parents take them, they're isolated, but we don't live in an ideal world. So is it the position of the Moore County Health Department that children that potentially have COVID going to our schools to get tested for COVID, is it your position that that does not pose a risk to potentially spread COVID in our schools?
The position of the health department is if you're unvaccinated, whether you're an adult or a child, you should be tested on the requisite schedule that the CDC and the North Carolina Department of Health and Human Services put forward. If you're symptomatic, whether an adult or a child, you should not go to work, you should not go to school, you should be tested.
But under the plan that's being proposed, those people would go to school to get tested.
If you're symptomatic, that is, I do not believe that is true. If you're symptomatic, you would go to your private doctor, or you would go
Yeah,
to
that's
the
not
health
what,
department.
unfortunately, that's
test.
not what I heard last week.
If I could interject, Mr. Hensley, I might could add a little context to it. We've always, from the beginning of the pandemic, if a student is symptomatic or a staff member is symptomatic, we have given that guidance and continue to communicate that guidance. Please do not send your child to school. Please do not come to school.
So-
In this case, with testing, if a child is symptomatic, we've already been saying, it's already on our FAQ, it's already something we'll continue to communicate. Never send a symptomatic child on the school bus. Don't drop them off at school. If they're symptomatic, call the school and we can arrange for them, if the parent chooses, to get that diagnostic testing when appropriate.
Yeah.
So we'll continue to communicate that. We would never ask parents to send a symptomatic or sick child on school bus transportation or drop them off at school. The fact remains, though, throughout the history of school, there have been sick kids who are sent to school, and we manage that as a school staff. I think Dr. Powers shared some data last month that 1 in 5 of the cases that we were seeing were students being sent who were already symptomatic. So we did a communications push around that about a month ago to remind our families to please don't send their students to school if they're symptomatic. So that's something we'll continue to have to double down on, continue to communicate around. But that's something that we've had to manage since the beginning of the pandemic, and even prior to that, with flu or the common cold or any other type of sickness.
Dr.
So-
Locklear, repeat what you said on October 21st about a parent that is closer to a school than they are to the health department. What provision can be made for them to still get tested at school if they so choose?
Yes, sir. They would call the school, talk to the school nurse. We're going to have regional sites where, with only 9 testing nurses, we're going to have regional sites if it's closer and more convenient for that parent to bring their child to the school campus to get tested. It would be like the drive-through testing sites that you see in other places. The testing nurse will come outside, the student will never come, the parents will never come inside the school. So that's how we handle that.
Yeah, and that's exactly, Dr. Locklear, the point that I was gonna get to when you started speaking. On one hand, I hear, and you just said it, we would never encourage our parents to bring a sick kid to school. But the last time we talked about this issue, there were plans in place so that if you had a sick school or a sick child, there'd be a drive-through testing at our schools for sick children. So I'm unclear which it is.
Well, the difference is when in the 1 in 5 that I referenced earlier who are symptomatic, they were going on the school bus, getting off, going in school, going in class, eating lunch. If you drop a kid off for regular school days sick, they're going in school, inside the
Right.
school building, going to eat lunch, going to eat breakfast, going to class. What I'm describing with our testing protocol would be the parent would call ahead, arrange a time to come by, would never leave the vehicle, be outside,
Yeah.
never go inside the school
Right.
campus.
Yeah, and that's exactly what I'm talking about, is they're bringing sick children to our schools. So that brings up another point. So let's say Moore County Schools offers, and it goes back to my original question, Mr. Whitman, of you and your team, is does this pose a risk to Moore County Schools and a potentially spread of COVID-19, even at what Mr. Locklear described? What level of precautions do we have to take? So let's say a nurse goes out and, administers a test and then walks back in and starts talking with, other staff members. Does that not increase the danger of that nurse who went out and gave that test and then came in and interacted with the staff and other children? Does that not increase the risk, however minor, of that infection spreading to our schools? You cannot say that's zero risk.
There's no such thing as zero risk.
So it increases the
period.
risk.
No,
Oh, it doesn't.
no. There
Okay.
is no such thing as zero risk.
Right.
If we were trying to get to zero risk with COVID, we'd all be in bubble wrap in some place that had negative pressure room. We can't have a society function with zero risk. What we've got is, and we do the same thing at the health department, we do not test people in our building. They're tested on a drive-through in the parking lot. All medical personnel, your nurses, are trained in universal precautions. And one of them is a mask. Others are hand washing. And so the risk, I would say, could not be measured.
Well,
on
I can,
that.
I-
So
I-
if they're not coming into the school. They're in the environment of their own vehicle, in a parking lot, and there's a minimal contact. And using universal precautions, I think it's perfectly reasonable to have the testing on school property. I do not believe they should go into the school if they're sick. Excuse me. I need to turn this thing off here. I encourage people that are symptomatic to be tested. And I think for the convenience of the parent, and not only convenience, but economics, is that they be tested, that they be offered a free test in a drive-through setting where they stay in their own vehicle. I think that that is, reasonable and safe.
Yeah, okay, well, thank you for that. It's my opinion that we're in the business of education, and the way that we have zero chance of that student spreading it, Mr. Whitman said there's no such thing as zero risk. Well, sure there is. If that student went to, say, a health department testing center and got a free testing, then we know that student isn't gonna come and potentially expose a nurse who then could expose other people. So the way Moore County Schools can ensure that that child would not cause an infection in our schools is that they don't come to our schools for testing. So, anyway, I'm finished.
You'd have to isolate, if you're trying to get your risk down to close to zero, you'd have to isolate everyone in the schools and keep them in the schools.
Yeah, well,
And
well,
not
sir.
let them go out into the community or go home. So it's just not a realistic, it isn't a realistic option
Well, sir, I
to
think
try to.
Sir, I think you missed my point. My point is, if that child doesn't go to a school to get tested,
No, I understand your point.
that's my point. And my point's limited to that. My point's limited to whether or not COVID testing at Moore County schools poses a risk of COVID exposure to Moore County staff.
I'd say it's not measurable.
I guess
the
we'll
risk.
see.
Let's move on to see if anyone else has questions for Mr. Whitman at this point. Mr. Levy?
Yeah, this actually goes to both Mr. Whitman and Dr. Locklear, because I'm not so sure who would know. I read that if we have a child tested and the test is negative, it goes nowhere, okay? What I'm wondering is, does it go into the statistical denominator of our county for a negative test? Do you understand what I'm saying?
I have the information on, you're talking about where the data goes?
Well, what I'm really trying to get at is, I truly expect lots of negative tests, okay? As a matter of fact, I would expect that a school testing program would actually have a major impact on our county statistics, okay? My question is whether a negative test on a child goes into our county statistics in the denominator so that it shows a negative test and then lowers our percentage of positive tests.
Ms. Fraley would probably be the best person to respond.
So the state, if they are antigen tests, which I assume they are if they're rapid tests, doesn't recognize antigen test as a confirmed positive test. Only
Just as
NAT.
we're not using antigen
We're
tests.
correct, we're using PCR,
We're using PCR
the
tests.
PCR
Then
testing.
it would go into the statistics. It is, well, let me back up a moment. Will there be a lab reporting the numbers to the state is the key in that.
Okay, well,
Will the
let's-
results electronically feed to the state? Because a manual entry from the health department is not calculated in those statistics.
Okay, well, Dr. Locklear, is that what we do?
I don't have the exact answer to that. I can tell you that based on the information that we put out on the FAQ and based on my understanding, we can research that a little bit more. The parent of the student being tested and the school testing nurse will receive the test results if it's negative. If it's a positive result, we would also be sharing that result with the health department
Right.
because we'll have to manage quarantine protocol and isolation with the health department.
Right,
And-
but what I'm trying to make sure of is that the health department doesn't just show that as a positive test in the numerator, but that the health department shows all of our negative tests in the denominator so that we have, if we have 1,000 tests, it goes into, creates in our percentage a denominator of an additional 1,000.
Yeah, that's,
If not, then we're testing, but we're not being realistic as to what's happening in the county, and we're not, and the county isn't able to be realistic as to be able to report it to the state. Do you understand what I'm getting at here?
yes, I do, and it's an excellent point. Under state law, that any laboratory that runs this test is required to report that to the health department and the state. And COVID tests from, let's say, Merck Lab, or LabCorp, any of these testing folks that are contracted by the state, they are required to report positive and negatives to the state, is my understanding, because they are required to report positive, but I believe that they've been reporting negatives along with the positives, and that's why we get so many positive tests, so many negative tests to get these numbers. But But Matt is
okay,
our
sorry.
statistician guy, and what we'll do is to confirm that for you, and we'll send that information through your school administration. And we should have that information. We have a Wednesday meeting every Wednesday with them, and we'll furnish that.
And
But,
Dr.
it should be in
Locklear,
there.
I'm sorry, I didn't mean to interrupt.
No.
Okay, and Dr. Locklear, I would hope that our administrators would make sure. Now, I assume we're using a lab, right? We're using some sort of a lab?
Yes, I believe we're using Mako Medical, I believe it's the.
Okay, we need to make sure that Mako Medical reports to either the county or the state or whatever, our negative tests. Because something tells me that we're going to get a lot of negative testing. I'm not necessarily happy with the testing overall, but so long as we're going to get the tests, we might as well make sure that those negative tests go to the health department. So maybe that's a quicker way to get rid of these masks, okay?
Mr.
So,
Levy,
yeah.
let me just add, I agree with you.
Oh, I appreciate that.
No, I do agree with you, and there's a section in the contract that I've had legal counsel working with DHHS legal counsel for specific clarification that even goes beyond that point, but I think that your point is germane to the efforts we've made. DHHS is a little slow in responding, but it's one of those things that we're following up on. So,
Okay,
but I agree, if it gives you any comfort, that's an expectation that I have as well.
Mr. Levy, I have a question for you.
Yes.
Where did you see that, that if it was a negative test, that it wouldn't go anywhere, that the information wouldn't go anywhere?
that's actually in our FAQs, where it asks where the information goes. And I believe in our FAQs, it says it doesn't go anywhere. I believe that's what I read.
Yes, sir, and it was probably related to where does my kid's information go when
Right,
when
right.
they get tested. If it's negative, the intent of that, and we, like I said, we're gonna follow up on that and probably offer some clarification in the FAQ. But the intent of that was to, hey, if your kid's negative, that's gonna go back to the school nurse, and you'll know it as a parent. If it's positive, we're required to also report that to the health department and collaborate with them. So that's what the intent of that was, but we'll definitely follow up and see if there's additional clarification we can offer.
I get that. It was a matter, I think you were trying to assure the parents of their privacy.
Yeah.
Okay, that was your
Yes,
intent.
sir.
And I get that.
Yeah,
I-
that's how
I
I
get
took it.
that.
Yeah.
And Bob, that,
Well,
so,
to your point, you can't get, I think they mentioned, a 5%, is once you get to 5% or lower for positive tests during that 7-day period, you can't get a percentage unless you have both.
Right, the
So-
numerator and the
so we've been
denominator.
the state's been giving us percentages all along, and I mean, you folks taught me that when I was a child in school. I mean, you can't get to you can't get
Yeah,
a
I just-
percentage unless you got both figures. So, but we'll make sure that.
If I may, I do know the answer to your question. I had forgotten that the school system was using Mako as the vendor. and we used Mako last year, earlier on in the pandemic. They report both positives and negatives to the state electronically, yes.
So I have a question, and it goes directly to student privacy. When they report positive and negative, are the names associated with those tests transmitted to the North Carolina Department of Health?
Yes. The
Okay.
name that's on the lab requisition, just as with any other test that's reported, all of that information is submitted to the state.
Okay, so to be clear, student identifying information is transmitted by the lab to the North Carolina Department of Health and Human Services along with the results of the test.
Correct.
Okay, thank you.
Okay, and I have a couple of other questions, which probably might not be so popular. But the vaccine and heart disease, which we're very, very concerned about, and certain countries, they have banned the vaccine for younger children. What is the position of the, I guess it's the enlarged heart, you guys know the term probably better than I do, okay? Isn't this something that we should be concerned about when thinking about vaccinating children?
That's something that I would refer to the parent and their medical provider, because the physician that has the history of the child and the parent, you weigh benefit risk, and I think what's been shown is the benefit outweighs the risk for the majority of children. But there may be some special condition that the child has that would tip it the other way. And so that's a decision I would leave with the medical, the physician and the parent. But by and large, what the study has shown is it's more dangerous for the child to get the disease, be at risk for that condition, than to get the vaccination and be at risk for that condition. So I would say, again, that's something I would leave to the medical provider for that child.
And maybe that's one reason why we should leave vaccinations to the parents and the providers rather than us in government trying to mandate. Yeah, or the health department or somebody.
Well, even if the government succeeds in their efforts to mandate this, there should be a provision, or I imagine there would be a provision for medical exemptions and religious exemptions.
Well, I will tell you the experience that my own daughter has had in California that is that the religious and medical exemptions are only as good as the people who decide on them, and sometimes they basically don't allow for that. And so.
I hope you're not asking me to defend
Oh, no,
California.
no. None of us defend California, that's for sure. But this is, also, let me see. I want to know where physically are these nurses going to be? So in other words, I get Mr. Hensley's concern that we don't want the kids, if we think a child is symptomatic, and symptomatic means like sniffles. A child has sniffles, he's symptomatic, am I right?
Well, it could be one of the symptoms, yes.
I mean, because to be symptomatic is to be decided by a layperson. In other words,
Yeah.
the mother or the father has to decide whether the child is symptomatic in the very, very first instance.
Yeah, nothing has changed since I came into public health over 50 years ago. And that is, if you have symptoms of an illness, whether an adult or a child, you should not go to work or you should not go to school until those are resolved.
And I-
If the symptoms are serious, you should seek medical help.
Okay, and let me, and let me tell you, if you've never been in a schoolroom and seen a child go
No,
like this with a
no.
sleeve.
I-
No, I know, I'm
Well, I
just,
also know the real world
yeah,
is that some parents, and this is sad to say, will, even if the child has got a fever,
that's right,
will give them some Tylenol and take them and drop them off at school.
that's right.
And so,
So-
that is a difficult thing.
So that, what I really want to get at is not so much that, but where physically are our nurses, our COVID nurses going to be located?
They'll be located in the same location our current school nurses are located.
So they're gonna be located within the building, in other words, not like in an outside, ante-building or something?
No, sir. They'll be in the building because the testing piece is part of what they will be doing. That's primary, but they also can support the other numerous things that our school nurses are doing, and support that work as well in the school building. And so there'll be a training period, et cetera, and then they'll be housed in our school offices.
So the symptomatic child, under these circumstances, will actually be going through the building to get to
No,
the.
sir. The
no,
nurse
no,
will
no.
come outside to do the testing. The nurse will come outside to do that. But if you've got a symptomatic kid that's identified at school, who got sent to school, who became symptomatic while they're at school,
Right.
just like we're currently doing, they would report to the office where each school has an isolation room to service that student and help that student and contact parents.
If I could, Mr. Levy?
Yes, sir.
Just a follow-up question with Dr. Locklear. Is it safe to say that these nurses will relieve our standard school nurses of much of their COVID-19 responsibility and allow them to focus on their original job descriptions pre-pandemic?
It's safe to school, it's safe to say, yes, sir. They're gonna
And-
do a lot of that, and that's gonna help our current nurses quite a bit.
So there could be some teamwork, but for the most part, this is basically doubling our school nurse workforce for the period of this year only to relieve our existing school nurses and allow them to address the other school health needs that our children have.
Once we're able to hire the full 15, you're
Right, and that's
correct.
not an oversimplification, I hope.
No, sir, I don't think so. Yeah, no, sir.
And I have one last question. In our COVID protocol, Doctor, are we taking, I know we're taking into consideration percentage of kids getting disease and, should they, trying to keep the incidence of disease down. Are we also, in our decision to mask, are we also taking into consideration the psychological effect of masking on the children themselves
And the mental health of the child.
and the mental health, whatever? Because that seems to me to be another component of this whole thing.
Yeah. I don't believe the CDC and North Carolina Department of Health and Human Services, I do not believe that that's in their consideration. I myself, I have concerns, especially young children, about masking. But that's why I'm optimistic that we can quickly get to mask optional if we stay the course that we are on now. And because I don't believe the federal government or the state government is gonna change their criteria. And I believe if we stay the course, that hopefully right after the first of the year, that we could get to a point to where we can, that the mask will be optional.
Is it the position of the health department that we just have to follow the federal government and the state government and that we don't have any leeway?
That's
Here and more.
correct.
Okay, so,
I mean,
okay, all right, no, that's
Yeah.
fair. That's,
Yeah.
it's fair. I just wanna kinda know, because our position here at the school board is that we must follow the health department. And because that's mandatory. And then the health department must follow the state, and the state then decides to follow the federal government. So really, one of the things, whether I prefer masking or I don't prefer masking, and I am a person who prefers optional masking, even today. But I hope the public understands that the problem of unmasking these children is a multi-tiered problem, okay? Because we have to do what the health department says, and the health department feels, and I may differ with you, but I understand your position, that the health department has to do what the state says. And so,
And the state's bound by, it's very difficult for the state to take a tact that's different from the Centers for Disease Control and the federal guidance.
unless the state is called Florida.
Or South Dakota, or
Yeah.
But
and I
elections have their consequences.
Yeah, I had that discussion with Dr. Grimacy and his staff before we had our first case in the county. He asked me, what is the tipping point where I, as the local health director, would close the schools? I told him that I will not close the schools. I said, that's a decision that that elected folks would have to make, either the school board, the governor, or the legislature. Legislature's not going to touch it, but the governor. So the governor has made it clear that we are following these guidelines, and he even put out his own directives, executive orders that we followed. So that's beyond the authority of a local health director when it comes to these things. But I will tell you, the reason schools would be closed in Moore County is that a school has reached a point that school administration would feel that we don't have enough teachers because they're out sick. Doesn't have to be with COVID, it can be anything. But there's not enough staff and there's not enough students to keep the things running. And so we maybe temporarily close that until whatever the illness was resolved, and we'd have enough staff and students to come up, and that would be on a school by school basis, And I think that's happened a couple from time to time where the census was so high for absences that they temporarily may close the classroom or close the school. That's a local thing, but the rest of it, you'd have to look to a governor or the feds.
Mr. Levy?
Thank you
Mr.
very
Levy,
much. Yeah.
Mr. Levy, with your permission, I'd like to just add a little bit
Yeah,
to that. I'll try to
please.
keep it real brief. Mr. Holmes asked a question at the last meeting that was a very relevant question that led to our health department representatives being here today. In fact, I think you even asked if they could be here. I tried to make the point clear that night, and I've tried to make the point clear all along, that when we have a health department recommendation, I do accept that as a burden, not a mandate, but a burden. So I take upon myself the burden to, if I'm going to do something different, that I have a strong case to do so. And that has sort of been characteristic of the ongoing relationship that we've had between the health department that I think has made it very healthy. That we take very seriously the health department's recommendations, but at no time do we say the health department made us do this if in fact the health department didn't make us do it, okay? We try to be honest about that all the time. I think it's notable that we did not have any school closures after we had employee vaccinations. And so we had such a high vaccination rate among our employees that even with the spike in the Delta variant this year, it never really, I'd say Westmore was the closest situation we had right there in the first week or two of the school year. But each day, Dr. Locklear and Dr. Powers are engaged with Ms. Huzzy, and the issue is, can we sustain school operations? Can we sustain in-person instruction? And absent a requirement from the health department, which we never had, we were in conversation every day. The conversation was, can we sustain in-person instruction? And as long as Ms. Huzzy and her staff felt as though they could, it was always, the burden was going to all remote. And so we were able to make it through that period of time with a lot of good advice from the health department, but never a mandate one way or another. So I'm just offering a little bit of a practical example of how that plays itself out and how we view our relationship with the local health department when it comes to recommendations.
Are there other questions?
Just a
Ms. Thompson?
comment, that I have for Dr. Locklear and his team, and to Mr. Levy's point, that I think we need to make it clear with our procedures as we move forward, the expectations of the parents as they get up in the morning and their child or children may have a fever or what other symptoms that we have already outlined, that this is the process for COVID testing. Do not put your child on the bus. Do not bring them to school and drop them off to get them on the inside. You call, and I think that should be really, really clear. And as we always do, communicate that out on Connect Ed, send a flyer, put it on our website, just so there is absolutely no confusion of what the children should be doing. The nurse will come out, you stay in your car, and that process, just so that is clear. Thank you.
Yes, ma'am.
Are there other questions at this point? Because we still have presentation to go, I understand.
Yeah.
Yeah.
Couple more slides, yes, ma'am.
Yeah.
Yeah, I just have just one comment and one question for Dr. Grimacy. So first of all, my comment is thank you all very much for coming out. I mean, we ask questions, but it's good to get firsthand information, so please don't take, our questions, I mean, we're just trying to get information and make sure we're making the correct decisions. Quick question for Dr. Grimacy. The ABC Science Collaborative, which we collaborate a lot, Dr. Whitman mentioned medical and religious exemptions. Does the ABC Science Collaborative have a position on exemptions?
No, they don't have a position on that. Their benefit to us has been a place where we can go. I'll be honest, that's one of the places I can be much more honest with ABC Science Collaborative about some of the concerns from my community and the dilemma that I feel as superintendent in trying to balance the various perspectives and looking for, I pressed ABC Science Collaborative very hard on the whole issue of sorting out the difference between seasonal flu and COVID-19, using that as an example. And I found them much more receptive to me carrying some of the doubts that I've heard from critics of our program, and them giving me, being willing to question and then citing the research and helping me think that through. So I think as a true research depository that is more open-minded and recognizing the dilemma we have at the local level, whereas with DHHS, I can be a little bit freer than Robert. I don't feel quite as free to do that. And so we continue to include the Science Collaborative as much as anything because they're sort of the true partner that's not, they're sort of outside the bureaucratic system. And I feel a much greater freedom there with the whole research side of it. That's,
Yeah.
how's that? That's the best I can do to kind of explain their role in this. And then, of course, we do enter in with them where we feed, not by name, no students' names, but our data goes to them, and they've conducted these these research projects that last year were pivotal in pushing in-person instruction, for which we're pretty proud of having been part of that.
Okay, thank you.
Yeah.
Any other questions at this time? One of the things that's been raised by several people is, how inconvenient it would be, or inappropriate it would be, maybe is a better term, to have, vaccinated children not having to wear masks, unvaccinated children wearing masks, whatnot. And I just want to emphasize that that's a load we will not put on our teachers to make them have to be a control guard, trying to differentiate between a child whose parents are saying, you gotta wear a mask, and that's just another thing that our teachers do not need upon them. They already have a new language. You know, they're real good about, during the course of the day, telling a child to pull up a mask, but I would not want to ask a teacher to have to do mask checks of who's appropriately wearing that mask and who does no longer have to wear one. So, I think, Bob, you kinda said it, it's gotta be all or nothing. When we give up masks, it's got to be across the board that we can give up masks.
Yeah.
Madam Chair, may I add
Yes,
to
sir.
that? Let me just put, in a rare moment of unanimity on the question of COVID-19 management, let me just put everybody to rest. I absolutely have no interest, absent a federal and state mandate in the strongest possible way. I have no interest in recommending such a approach to this board. And so we've got a lot of things to wrestle with, but I'd like to put that one to bed. We don't need
That's
to be
good.
wrestling.
And I'd add my voice to that too. I have no interest in that. I believe it would cause, as I said earlier, confusion at the best, chaos more likely. The other thing I want to mention about masks before I leave this subject is the masks that people are wearing are not meant to protect the person that's wearing. They're wearing the mask. The mask is to protect others in case you happen to be, have an illness. It could be COVID, it could be seasonal flu, it could be whatever, upper respiratory, lower respiratory infection. If you're talking loudly, coughing, sneezing, I learned this in the public school where they showed the little, the person that sneezed and they had the black background and how far it would travel. That's what we're trying to prevent is the spread of it. And so having a mask is not to protect me, it's to protect others in case I'm coughing, sneezing, or getting over exuberant, talking loudly, or whatever. So I want to see these masks go away. I think that the plan that's outlined, that this board has outlined by visiting this monthly, and then maybe consider, we've got these holidays coming up, to revisit this on the 10th of January and do that, looking at the benchmarks. I think that is a wise way to go forward, and I congratulate you on that, and also your administration.
All right, unless there's a further question, we'll go back to Dr. Locklear and see what else you have to say.
Yes, ma'am. Just a couple slides with the metric and data that we've been discussing and Mr. Whitman discussed in his letter. This is a slide that we didn't have in last month's presentation that represents the historical County of Moore community transmission and percent positivity rates. That was the information alluded to in Mr. Whitman's letter. I will note, if you look down on the bottom, it has the chart that tells you when you're in the high, substantial, moderate, or low range. And Mr. Garner looks like he's grabbing the mic, so he looks like he wants to interject.
I
here. Go
just
ahead,
want to
Matt.
make just one correction here, Dr. Locklear.
Okay.
If you look at that top left column there that says new cases per 100,000 persons in the last 7-day period, just to make a quick correction that I noticed, that is looking at our daily average. I believe those numbers got transposed. So essentially, it's since we are a county, our population is roughly about 100,000 anyway. It essentially translates to how many cases did we have the previous week, and I can send you this updated data and give it to you. But roughly, that stands at about 120. We had 124 cases last week, so that puts us at about 120, which leaves us in the high level of transmission as far as cases there. If you look at that scale at the bottom. The percentage of positive tests, those are all correct there. Those have all been coming down. But the trend that it's telling you is indeed true. These numbers have been coming down substantially, especially over the past month. But I can send you that updated number. I think those two numbers got transposed. That's just showing our average per day, which that's correct. But we want to look at what the CDC transmissibility index is looking at, which is cases per week. So
Very good.
that's
Thank
total.
you.
But I can send you that, no problem.
Yes, and we'll correct that for next week's presentation, and we may have the week of October 25th as well that we can add to this chart for next week.
And I'll add to that too. We each week in communications, I communicate with Dr. Grimacy and also Dr. Powers. We get the demographic update from the state NCDHHS that tells us, in particular, what we look at is the 0 to 17 cases. That's one thing that we look at most of all. But it gives us an update of our total thing. And I send that to them each Monday. So each week we're reporting on the previous week.
Yes, sir. So there'll be corrections to this chart, and we'll get that out. And if we have it corrected, we can share it with the board ahead of time as well, so you'll see it. But as Mr. Garner noted, the trend is trending in the right direction. You'll see that in the next chart as well. And the bottom key is still how that's determined, and it's not an or. It's got to be both for it to be in that range, or the higher of the two for the range. Yes, sir.
I just, why the health department people are here? I have a question on these numbers, because the numbers seem, look, you have to go with something. Something has to be the baseline. But it seems to me, if you do the math, and 20 new cases, this is just my view as a layman on these numbers, 20 new cases in Moore County with 100,000 people, that's 1/1000th of a percent of new cases in Moore County. So if you take 20 new infected people, that's 2/1000th of a percent of people who ostensibly got COVID that week in Moore County. 2/1000th of a percent. Then you look at the percentage of positive tests in a 7-day period. Well, that's almost 9%. Well, that's because people who feel fine don't get tested. But if you take the first number and you lined everyone up in Moore County and got them tested, it would be something like maybe 1/1000th or 5/1000th, or however the math works out. So the second number there that we're basing whether we're going to wear masks or not, because we got to get in the low, it's 100% dependent on whether or not people who feel fine go and get tested. Is that not a fair assumption? No, it's not. I mean, right there, if you take 2 and divide it by 100,000, you have 2/1000th of a percentage of people in Moore County who got COVID the week of October 18th. But you're saying the percentage of positive tests are 9%. But only 2/1000th of the people in Moore County got COVID that week. So if you lined everyone up and say the infection rate was actually 10 times greater than that 20, say there were 200, that would be 2/100ths of a percent, which is still significantly below 9%. The numbers don't seem genuine.
Yeah, well, I understand what you're saying. The Centers for Disease Control picks something that is measurable, because you can't line up 100,000 people and test them every week and get the results. So what they picked was, out of all the people that are tested during this 7-day period, how many were positive and how many were negative, and you come up with the percent.
Right. So of the subset of people who got
But
tested,
that's something that's measurable, that you can see go up and you can see go down.
Yeah, it seems like a better, so those are people who voluntarily, for one reason or another, went and got tested.
What would you propose the CDC use as a test?
Oh, I've got an answer to that. A random test. They go out and they grab 100 people in Moore County at random. They go to Pam Thompson's Food Line, they grab 100 people and they do a test of a random sample because those people, the people who got tested, it seems to me, are people who either thought they had COVID or went to the hospital. For some reason, they got tested.
Well, right now, you're getting those random tests because you were saying that if you haven't been vaccinated, you must be tested. And
Who's
so
saying
you're
that?
getting that. I think that there would be people with torches and pitchforks if we went out and grabbed people off the street and say, I'm gonna test you.
Oh, I'm not questioning that. I'm just saying, so right there, Dr. Whitman, you said that if the people who are getting tested are people who are not vaccinated, well, right there, you've got bias because let's say 70% of the people are vaccinated and let's say the vaccine is efficient and effective, then you're not testing 70% of the people who don't have the virus or who wouldn't possibly get
I
it. So,
understand, but that's the ones that would be most likely to spread it, and ones that are not vaccinated. Is that what you're saying?
no, well, what I'm saying is that what I'm saying is the percentage of people that test positive, that number, you're testing the people, it's not a random test. It's people who presented themselves for some reason to get
Yeah,
tested. It's
and
not a
right
random
now-
selection of the population.
Yeah, right now, there's people that are being mandated to be tested because they haven't been vaccinated. And so that gives you a bigger pool to draw from.
But it's still not random. It's all of a sudden, that's a subset of people who haven't
but
been vaccinated.
I also believe that people that have had COVID and recovered have some natural immunity.
Right.
And that would be included in that population that would be that would be mandated to be tested, because I don't wanna get the vaccine. And so, I got sick with COVID. I've recovered, but I'm still mandated to take it, but I've got some natural immunity. So that'll be like a vaccinated person in my mind. So you're getting a mix of people that have some natural immunity and people that have not been vaccinated in this pool. I'm just trying to think of a better way to measure it that's comparable. They picked this, and all of us are using this throughout this state, I believe,
Yeah,
across the nation.
it seems to, well, if you look, again, if you look at those two numbers, it overstates it. And I can tell you it overstates it because on the left, you have 0.001% of new cases, but you say you have a 9% positive
I just
rate.
don't see a better way to do it.
Well, random sampling is the way you do it.
Well, like I said, I think we're getting about as random, we're getting sampling from people that are healthy,
Well, sir,
as well as people that think that they're sick.
I'll leave it at this, but I'll beg to differ because I'll say those numbers right up there contradict that directly because you've got 3/1000% and 11% positive. You got 2.5 1,000th and a 10%. I say those numbers right off the bat say that the percentage tested in 7-day period say it's not reflective of the actual infection rate.
I see your point, but what I'm saying is, I believe this is the best metric that we can
Understood,
come up
sir.
with without grabbing people and forcing them to be tested, which I'm not in favor of.
Well, there's other
at all.
ways to do random testing, but yes, sir, understand. Thank you.
Mr. Hensley, can I add
Yes.
to the conversation? Our experience in tracking our internal school data would indicate that the patterns are more important than numbers for us,
Yeah.
and that the patterns have a general enough relationship that we pay attention to this, but it doesn't drive the decisions. And so I'd come back to the statement I made before about health department recommendations are taken seriously. As long as they're recommendations and not mandates, we can take them seriously, but they don't have to compel the decision. It's a burden, but it's not a requirement. So in this particular case, the thing we've seen, and particularly with Mr. Garner's involvement with us, we've tracked separately the 0 to 17 age group, and that pattern also has sort of followed the schools. And what we see currently this week, you can see it in your weekly report, about 68%. I get to the age 5 to 17 group by simply adding a statistical consideration of 24%, 0 to 5, are those children that are not in school. So I just automatically take out 24%. And again, I'm looking at patterns, not specific numbers. If I take 24% out, and then I look at take our weekly infection rate, apply that to what's left, that last 76%, we got about 68% of the infections. Now, if I did that once and it was way off, then I wouldn't do it again. But that pattern is held since like last spring. It's an interesting pattern to watch. And Matt has been very helpful in working with Dr. Powers and I in watching that. So when we look at it, we've got interesting patterns. Now, what I also know is in the 4 weeks before spring break last year, 4 or 5 weeks leading into spring break, just as we went to K through 12, all students in school 5 days a week for the first time at the end of March. We had what Dr. Powers and I call green weeks. And then the last 3 or 4 weeks of school, we had again green weeks. And what we had there were infection rates, student infection rates that dropped below 10 per week. 10 per week, not per day, but per week. Not per day per week, but per week. What we noticed about that was that's when quarantines, absences due to quarantine on that 1 day a week read, dropped below 200, 150, and even 100. That's when administratively you're looking at impact on absentee rate, which then gets down to where it's almost negligible. It's down to where just colds, and the same thing. The only difference with COVID at that point is its potential, not its actual impact. We're looking at all those metrics in addition to this, and I would say that you guys, in reading your weekly report, you can see the direction this is going. And so I think that it's safe to say, while I am recommending masks this month, I said back in August that I'm not married to that, and I think in December it's going to be real interesting if the pattern continues. I'm interested to see what happens right after Thanksgiving, because last year after Thanksgiving it bumped. Well, what if it doesn't this year? Well, that'll be cool. Yeah. Then the only other thing is, okay, what's it going to do after Christmas? That's where the risk is, okay? Would you look at it then? And so what as Mr. Whitman is talking about January today, it could even be before January, but certainly January is that point where you can see what it's going to do right after Christmas. So this is an interesting pattern. There's a valid debate on the metrics of it, but I take that in consideration when I'm looking at this. And Dr. Powers and I, though, our main concern is what is our infection rate, what is the impact on absences as a result of quarantine, and how does that affect operations, and what might that implication be if we didn't have masks? Those are our critical questions. All this adds to it, but it's not by itself what drives the decision. So if that helps, it does. And you guys can continue the debate on the metrics because it's a valid debate, but that's what parking
No,
lots
and it's good. At some point, it becomes esoteric, and clearly there's a correlation between the two. It's the denominator is not the whole pool. Anyway.
I just have one brief question. Yes, I just have one brief question. I'll try to make it real brief. For purposes of quarantine, we consider a person who has had COVID as being, quote, vaccinated for if he has had it in the past 90 days. Why do we limit it to those 90 days when it seems that having COVID and recovering from COVID is actually the same as being vaccinated, but we don't quarantine people who have been vaccinated beyond 90 days previously? Do you understand the question?
So that is CDC guidance at the time, based on studies of people that have had COVID infection. And that is what drives our recommendation, is based on that information, 90 days.
But isn't it true that beyond 90 days, a person who has had COVID and recovered has the same immunities at least based on at least one Israeli study, has the same immunities as a person who's been vaccinated.
Yes, it's possible, yes.
Okay, so is there any possibility of you guys at the health department not quarantining people who have had COVID and recovered and considered them as a vaccinated person for so long as you consider a needle vaccinated person?
Not under the current recommendations.
Okay, so once again, it is the CDC and the state saying this is what we have to do. So there's no, okay.
Mr.
that-
Levy,
that I
if I
understand.
could add to that, because it's
Yeah.
a great question. When I pressed the ABC Science Collaborative in the way that you just pressed the health department, what Dr. Mike Smith showed me was a normal curve, and the median and the mean were lining up at 90 days, and so then it would subside after that and would subside before that. So there were actually people that would begin to lose the, what's the word, antibodies, what's the word? Yeah, their antibodies actually begin to diminish before 90 days, those that do it after 90 days, but 90 days is sort of the sweet spot.
And I actually understand that, but did he put beside that the vaccinated person losing the antibodies over that 90-day period? Because the breakthrough infections, as I understand it, are the same.
There wasn't he didn't have a slide on that, but we talked about that, and obviously the vaccinated individuals had more protection beyond the 90 days. And it was at that point where a lot of the discussion about breakthrough, this was like a month or two ago.
I remember you reporting it
was
to us.
Unfolding on that. So
And
the only thing I say is stay tuned, because, as we go on, there's more research that's being done. But currently, right now, because I pressed our own health department on this issue about that time, and they gave an opinion, so I tested it out with the ABC Science Collaborative, and they were all lining up with 90 days at that point.
I understand, but I feel that if they take a look, at least the one Israeli a report on that, I think it's more political than anything else, and that's my concern. In other words, that there is a bias toward vaccination and a desire to have everyone vaccinated regardless of whether they have had COVID previously, because not prevention of COVID, but vaccination is the goal. And that is really where I think the public gets very, very upset. And I'm not blaming anything about the health department. I understand you view your role as following the CDC and the state and the like. So maybe my beef is with the CDC and perhaps with the ABC Science Collaborative. But I believe that this bias toward vaccinating people and quarantining people who are unvaccinated when they have the same immunity as a person, as a vaccinated person, is just wrong. But I understand why you do it. Why you do it.
But certainly, Ms. Fraley, as you consult with Dr. Powers on quarantines, she certainly recognizes the 90 days, Mr. Levy.
No,
And-
I understand. I just
Yeah.
feel that it shouldn't be 90 days. It should
Right.
be the same as being vaccinated.
Correct.
In other words, if there's a limit to the vaccination, I don't think there is, on quarantining, then there should be the same limit on people who have had it and recovered. Because I think the antibodies are actually even better when you've had it and recovered. At least I think that's the result of the studies that I've seen.
Libby?
Mr. Dennis.
I just have one comment. Within the last couple of days, and I haven't seen the study, but I either heard or read somewhere that the CDC did a study and said that people with natural immunity versus those who have been vaccinated, that the ones with natural immunity were 4 to 5 times more likely to catch COVID again. But I say I can't document that, but I just heard that within the past day or so.
Okay, well, we'll let that one go for right now, because it doesn't really pertain to what we've got going on here. So Dr. Luckler, let's let you finish up.
Yes, ma'am, and I just want to note again, Mr. Gardner noted that the first column, new cases per day, that was transposed, and you'll be sending me corrected data. So that will look differently next week. I will update that for the public and the board.
And for the historical record, we'll correct this one.
Yes, sir.
That the one that's attached to today's, we'll make sure that's accurate.
We will do that as soon as we get the data from Matt, and we may also have October 25th to add to that. This is the data that Dr. Grimacy was referring to, and that we've noted that we've been tracking. I think Matt talked about the 0 to 17 cases. And you can see, I'm not going to read through all this data, but you can see over that month time period that the data is tracking in the right direction. When we look at our last week total county of more cases, 37, our new student infections 22, the quarantines that caused, and then the number of abscesses. And as we also noted earlier, group quarantines, we've had none of those over the last 3 weeks, so that's really good news. The data is tracking in the right direction. But as Dr. Grimacy noted earlier, the staff recommendation continues to be that we continue with masking for another month. At all pre-K, K-12 students continue with masking indoors, at indoor athletic events, and on all school bus and activity bus transportation. And the desired outcome with that is to continue to limit as many students as possible who have to miss school, and to continue to attend face-to-face as many as possible. So with that, if there's any other discussion or questions.
Anything else? All right, then let us offer thanks to Mr. Whitman and Ms. Fraley and Mr. Garner for joining us this morning. We appreciate you giving us your time and expertise as we all continue to work toward the same goal, which is to have everyone healthy. And I think we'll be good to go. Thank you very much.
Thank you.
Let's take about a 10-minute break at this point. Let's come back in at 10 after and give everybody a chance to move about.
I've got the print out.
I'm gonna be out and about, I better go do it. I was thinking of all the treatment.
Right, I never have that, because I've never been, haven't been sick, and although there is an interest on that, I take certain, certain, listen to the TV, and there's some
Yeah, that was,
one or two of the pills that I take supposedly prevent COVID. I don't know. I don't do it to prevent COVID, it actually has to do with high blood pressure.
Yeah.
Maybe I lucked out. But it would be interesting. gonna take
All
us
right, let
for a
us
while.
go ahead and come back into session. We'll move on to item 2B, the exceptional children contract for speech-language pathology. Dr. Grimison?
I'll turn it over to Dr. Metcalf and Dr. Bullard.
Thank you, Dr. Grimacy. Madam Chair, this is a request for approval of a contract to provide exceptional education speech-language pathology services for the current school year, and Dr. Bullard is going to provide the details.
Good morning, Madam Chair, board members, and Dr. Grimacy. I am requesting approval on a contract for speech services that are required for the Exceptional Children's Department. This contract is with a provider that we have previously used for services. We are contracting for this service as opposed to hiring our own staff to perform these duties based on three main factors. It has been difficult to find qualified personnel to serve in this vacancy. It is more cost-effective to contract for these services, and while these services are required, they are student-specific and may be short-term, so the need for the staffing may extend past this term. For the recommended contract, 4 additional companies provided pricing information for comparable services. The contract recommended for award is the lowest price provider. Moore County Board of Education Policy 2500 authorizes the superintendent to enter into service contracts of up to $50,000 that requires board approval for service contracts in excess of $50,000. Dr. Grimacy has authorized expenditures of up to $50,000 pursuant up to the terms and conditions of this agreement, thus allowing services to begin as soon as the therapist was available. These services are required by individual education plans to meet individual needs of students, and by providing these services as soon as the therapist was secured, the need for compensatory time owed is decreased. The contract brought forward is projected not to exceed $52,000, thus requiring school board approval. These services will be paid from PRC 304 cost reporting funds, Medicaid reimbursement that cover contracted services only. Are there any questions?
Are there questions for Dr. Bullard? This is a fairly standard contract and obviously a service that we have provided for many years
Yes, ma'am.
to students. Do we provide this service to students in the pre-K or NC?
Yes, ma'am.
I thought it started even before school age.
Yes, ma'am.
Are there questions for Dr. Bullard?
Madam Chair, just so I could say this for the record, I must abstain from any discussion on this and as well as a vote on this because I believe I have a grandchild who has received services. So I just want to explain that. So I'll be declaring just a conflict of interest on this.
Thank you. I don't know that it would absolutely be necessary for you to abstain, but.
I don't think it is, but out of an abundance of caution, I just want to make sure of that.
Any questions for Dr. Bullard? All right, seeing none then, we'll say thank you for your time.
Thank you, Dr. Bullard.
All right, we move on now to item 2C.
Madam Chair, one of the most unique original budgets I've ever been party to presenting. I've never, in my 20 and a half years as a superintendent, have never been confronted with a state that has not yet approved its budget in the month of November. And we have run out of time. We do need to bring an original budget to you. And so I'm glad that the capable hands and mind of Mr. Cox is here to present this original budget to you and entertain whatever questions you might have. Mr. Cox, was that enough of a lead-in to give you time to get set up?
Sure, thank you, Dr. Thank you, Dr. Grimacy, Madam Chair, board members. Charles, if you'll go to the actual presentation. All right, perfect, thank you. This is the original budget resolution for the fiscal year 2021, 2022. And I do want to recap the budget timeline for the current fiscal year 2021, 2022 budget. Back in January, the superintendent's budget committee got together multiple times to discuss the budget and information pertinent to developing the school year budget for fiscal year 21, 22. Also in January, there was a full board budget work session that was held to discuss budget-related items. In March, the superintendent presented his proposed budget to the board. And then the follow-up to that, there was a public hearing on the board. There was a public portal that was available for the public to make comments, provide feedback on the superintendent's proposed budget. And then in April, the Moore County Schools Board of Education approved the budget that was presented to the county commissioners in May. In June, the county commissioners approved their budget, letting us know what our level of funding we would be receiving from them was. And then typically, I'm not going to say July because it doesn't happen very often that the state passes a budget in July, but sometime shortly after that, July, August, maybe September, a state budget has been passed. But as you see here, November, we're still waiting on a state budget, so we still do not know our final numbers for our state funding, which impacts certain things. As we've talked about in our line-by-line budget meeting we had, I kind of went over some of the things about budgeting, and one of those things was the challenges with our budget timeline, where we have to present a budget and approve a budget before we know any county funding, we know any state funding, or have any projections on those numbers. So just want to reiterate the challenges of the budget that is done with the constraints of the North Carolina state law, because North Carolina law outlines when we have to have our budget, when the commissioners have to have their budget, and then when a state has to approve their budget. So again, just to recap on the budget timeline, essentially what this is the budget that was approved. Typically when we come back for the original budget, it's a budget that the board approved back in the spring with small modifications based on what the county has done with their funding level and what the state has done with their funding level. So we talked about state budget. There is no state budget. You have seen this slide. We talked about an update on that. The Senate does have their version they passed. The House has their version they passed. Right now where we are, the House and Senate are currently negotiating with the governor. This is something that typically has not happened in the last few years. As you know, we have not had a overall state budget. We've had what we call mini budget bills that have passed. So the General Assembly and the governor are working together, trying to come up with a compromise that once it is passed, the governor will sign off, because the last few years, the General Assembly has approved a state budget that has gone to the governor that has been vetoed and has not been put into law. So you see here, there's some things: retirement rate, hospitalization rate. All these are significantly larger than what was in the past year. There are some salary increases projected with $13 per hour minimum for classified, and bonuses vary between the two budgets. So still a lot we don't know, but just kind of wanted to recap some of the things that we do know and where we are within the state budget process. So we talked about fixed cost increases for Moore County schools to local expense. We originally projected $1.1 million to implement the classified salary scale. We talked about projected $365,000 for increased salaries, increased retirement rate, and increased hospitalization rate. We previously talked about other projected fixed costs, primarily salary supplements to our teachers to remain competitive with other districts of $195,000 there. We talked about projected charter growth of $328,400. There was no talk about teacher and staff bonuses in the budget that was passed back in the spring by the board, for a total projected fixed cost increase of just over $1.9 million. What I've done here on the right column, I've estimated revisions to this because we still don't have a state budget. We still don't know the true numbers. But because we have a House budget, we have a Senate budget, it's kind of narrowed down our projections. So it gives us a little more confidence of what those numbers may actually be when a state budget is finalized. I've got a reduction there, $825,000 for implementation of the classified salary scale. It's not because it's costing less. The reason we've reduced the cost there is because we anticipate the state giving us money when they implement the $13 per hour minimum wage. So it'll be a lower cost on the local dollars that were anticipated, but it's not a overall lower cost. The state's going to contribute some toward that. That's why we reduced the local expense there.
Mr. Cox, I have a question on that, and really it's just to refresh my memory. We set a minimum wage. When we implemented the classified salary scale, what was the minimum wage that we set? I think it was 11, 12.
It's 11 something the lowest, and I can't remember the exact
Yeah, it's
dollar amount,
11
but it's something just over $11.
Okay, so if the budget goes through the way we think, that's actually gonna be raised up to $13 an hour.
Correct. So we implemented that classified scale effective July.
Right,
If that $13 minimum per hour goes by, and we don't know what the state will do, but historically, they have made that retroactive back to July. So that scale will go up to $13 effective July 1, if that is written into legislation, which it typically is. But because we're so far down the road, we don't know what ultimately will be.
the only thing, and the reason I bring this up, one was to refresh my memory, but two, we just have to be careful, and I'm sure Dr. Grimacy, you and your staff have already thought about this, is compression in the salary schedule, so we gotta uncompress that.
That's correct.
Okay.
That's correct. And Mr. Cox, if you could, is it premature for you at this point to estimate what that compression effect would be if the bottom came up by $13 an hour? Does this total amount represent recalibration of the scale, or is it just a compression effect from the bottom up?
Right now, this is a compression effect,
Right.
so it's too early to say what decompressing that will be.
Understand?
We
Okay.
didn't want to go too far just because we weren't 100% sure. We think it's going to happen, but we're not sure at this point.
Right.
Right, and just to be clear to the public who may not understand the code that we just developed, by compression is, if, let's say before it was $11 an hour minimum, all of a sudden it's 13, well, then you have people who've been working here for 5 years that are making the same as someone who just started, so that needs to be spread out to
That's correct.
recognize longevity and
That's,
whatnot.
yeah, that's correct. And we've thought about that. We haven't finalized that, but we've
Okay.
discussed that.
Very
We'll-
good, and
we'll
I
add
knew
that.
that we knew what we were talking about, I just wanted to make sure they knew what we were talking about on the compression.
That's correct.
Thank
No,
you.
nobody loses in that, some gain.
Yeah.
And so then what we have to do is look at everyone else and see to what extent can we afford to make sure that that gain is shared all the way up.
Correct.
But nobody loses.
Right,
That's
and there's a
one-
cost.
That's one talk point we've got to make clear.
Correct.
But we've got to see how this plays out, define the problem, and then figure out the best approach to recognizing that, yeah.
Understood, thank you.
And Mr. Cox, I know that in your comments about the teacher increases, but at this point, we don't know, obviously, what that percentage is. Do we know, maybe like, expectation, is it 5%, 6%? Have we heard what that may be?
We have not heard what the
Okay.
talks going on between the governor and General Assembly are. They ranged from 3% up to, the governor was the highest, and I can't remember what his was, but it was I think the House was 5%, and the governor was above that.
Okay,
Okay.
okay.
And we projected at 3% for certified. We projected classified at 1%. That's probably going to be higher now after discussions, but we certainly don't know. Retirement, we may have slightly overprojected what we're hearing between the House and the Senate right now, not a final, but it's probably going to be somewhere around that 23%. Hospitalization between the House and the Senate, what you saw on that previous slide, both of those are over $7,000 per employee. So we underestimated that. We estimated a $200 increase, which has historically been about what it's been. And they have projected right now about a $7,000 per employee cost of hospitalization. So that's why that number has increased some there. But again, we ultimately don't know because it hasn't been finalized. These are our best guesses right now after seeing the House and the Senate budgets that they have passed, although it's not in law at this point.
Mr. Cox, I'm sorry, I just had another random thought. So, do we pay the employer's portion of Social Security? Do our employees pay Social Security?
We pay 7.65% for FICA for each
Right.
employee.
Even though they're covered by a state retirement plan?
Yes, sir, we pay 7.65% for each employee. We pay almost 22% currently into retirement system per employee, and we pay over $6,300 per employee for hospitalization.
Yeah, it just, and again, no editorial comment attached. It's just remarkable that our employees, we pay 23% of their pay to a state retirement plan. Then on top of that, between the employee and us, we pay another 14% to Social Security for that same employee. So again, no editorial comment, but 23% plus 14%, 37% goes to Social Security and retirement. That's a very high amount.
And you can add hospitalization to that
Right,
as well. Yeah.
right, yeah.
The, I would add that for state employees, Mr. Cox, that's an in and an out. The
It
state
is. The
gives
state
us the money and we pay it, but it's the locally funded employee. That's the learning moment for local taxpayers, Mr. Hensley, as you know,
Right.
is that it's those, every time we have a locally funded employee over what the state does, then that total cost is what we're paying locally.
Yes, that's correct. The state does give us the money for these increased rates for our state-paid employees, but state-paid employees are not enough to keep the district functioning and providing the services that are needed for our students. So we do have to have some locally paid employees, and that's where this impact comes in.
Just one question. Is Social Security optional for us?
No, sir.
It's not, okay.
All right, so I left the other projected fixed cost increases at the same. That may change if the teacher, the certified rate salary increases, but that'll be a discussion that the board could have at a later date, depending on what the state budget ultimately impacts. The projected charter growth, we left that at the same because that's not impacted what the state does. This is solely based on the amount of money that the county gives us for our local operations and the projected charter school enrollment. And at the time, as I mentioned, there were no teacher staff bonuses. We know in the House and Senate versions of the budget, they talked about providing bonuses for teachers and staff. And if that does go forward, we know there will be some costs that we're going to need to pick up to pay bonuses for our locally paid teachers, because some of the language for those bonuses were state-paid teachers or employees. I don't remember the specific language, but it was specific to state-paid. It did not address the locally paid. Now, last year, you may recall, there was a bonus that was paid to certified employees, but the language was written in there was all. So they covered the cost for those locally paid and federally paid staff members, where some of the bonuses are written into the legislation, as it is right now, again, because that's why I say I've estimated revision. It says state, which we would have to pick up the cost for those locally and federally paid, or the federal programs would have to pick up the cost for those. So that's why I've added a cost in there. So almost $2.1 million estimated revision of fixed cost increases that would impact our local budget.
And when do we anticipate being able to validate our charter school growth?
And I'll talk a little bit about that later on in the future, so when I do a summary, a little bit about it. All right, so here's just a historical perspective over the last few years of the county funding that the county commissioners have provided to Moore County schools. You see that here in 2021, 2022, we're at $31,850,000, which is a budget that is level funded, no change at all from the prior year. So you have a 0% increase. I will note, as you see, noted by one there in 2017-18, the county did give us 1.2 million from their county fund balance as additional one-time funding. And then in 2019-20, they also gave us another one-time funding amount of $739,000 to help offset the cost of opening the new McDeeds Creek Elementary School. So where do we go from here for our budget and talking about the fixed cost increases that we have? So we're projected to have an overall fund balance in Fund 2, which is our local current operations as of June 30th, 2021 of $6 million. So how did we get to that amount? In fiscal year 21 or school year 2020-2021, we had a lower average daily membership due to the pandemic. And something that General Assembly did, they passed a legislation that held us harmless. Typically what happens is when you miss your projected number that DPI funds you on initially, which we've talked about how we're funded, we went over that refresher in the line-by-line budget meeting a couple weeks ago. The General Assembly passed what they called a held harmless, which held all districts harmless. They did not take money back from school districts for not meeting their projected ADM last year because of all the things going on with COVID and the potential for needing those dollars for responding to the COVID and the pandemic. And then, because we did have a lower ADM, we were able to shift some locally paid positions over to state funding to be able to save some of that local money for future use. So that's how we got to our $6 million projected. It's not finalized because our audit hasn't been finished at this point. So what our plan for this budget is to assign $2.1 million of that fund balance to cover the anticipated fiscal year 22 fixed cost increases. And once the state budget is finalized and passed, we'll know if we need more or not as much, but we'll have it approved for us to expend. Should we not need it, it will roll back into fund balance for use in a future year, or depending on if the board changes their priorities, we may need it for things that the board may change. So what this will do, it'll leave an unassigned fund balance of $4 million. As the board is well aware in previous presentations, $2 million of that fund balance we use for cash flow for delayed reimbursements. As we've talked about multiple times, the federal government is on a different fiscal year, fiscal year than we are. 85% of our budget is in personnel, salary, and benefits, so we have to have money because we haven't got our federal allocation when we start the year, and we typically don't get it till November or December. So we have that $2 million to use to pay that federal commitment that we have for our federal staff, federally paid staff. And then the remaining money that's in that unassigned fund balance will be used for subsequent years to reduce the funding cliff or any other programs that the board may choose or how they see fit to use that money that's there in fund balance.
Let me ask you a question. So we have $2 million, which we're going to be keeping. $2 million as like a mandatory fund balance, right?
Yes, sir.
Okay, that's like an overdraft protection. For lack
Yes,
of a
sir.
better
Correct.
term.
Correct.
Okay.
Yeah, it's a great way to look at it.
All right. But $2 million of that, $2 million is still left for us to do something with. What is the approximate cost of putting teachers in grades 4 and 5 that approach the same ratio as grades 1 through 3?
I don't have that call. I know.
That was.
Well, I know Dr. Locklear did.
That was part of our discussion when we did the budget in the spring. So that information is available to us. We need to go back and get that. Today, with the original budget, this is a presentation of what you already approved in the spring. If we were to consider options for that $2 million, we'd have to go back and reevaluate the risk associated with using that in some other way, which would be to relitigate the budget. So I'd say at this point, we can go back and look at that, but Mr. Cox isn't going to have that information off the top of his head.
And I do want to emphasize or clarify, this is one-time funding. It's not recurring funding. So if we did that, we'd only be able to do it for 1 year or half a year, you know, since we're already in November for this year.
But it would be an excellent well, if we started it in next year. Okay,
Right.
because we still have that 2 million, I'm really
Right.
talking about, 21, 22 as opposed to this year.
That's an option that's
Okay.
available to you.
Yeah.
Yes, yes,
What
that's about.
I'm really saying is that the county commissioners always look at us and say, well, look, you got $6 million in your fund balance, so you guys have plenty of money, okay? So it's important that if we're going to go with some of these initiatives that we know that we need, like lowering the student-teacher ratio, and if we have the money to do it, that we actually do it, and then look at the county commissioners in the eye and say, look, we're going to need some additional money to continue this, or we're going to have to get rid of teaching staff and now double our ratio in grades 4 and 5. To which they might say, oh, well, it's a good idea, maybe we'll give you some more money to do it. As opposed to simply looking at a $6 million fund balance, and at best, if they really understood it, to know that there's a $2 million in excess of money, and them saying, well, you're doing fine with your money now, and you've got $2 million to in excess, so why should we give you more? It's, you know, we've got to lower these class sizes in grades 4 and 5. And we kind of have an opportunity to do it, so I hope we will start thinking about using that $2 million in that way. And if the $2 million isn't enough to do all of our grades 4 and 5, then how about our lower performing schools, which really need the help, and we call them restart schools. Let's give them a little restart, certainly in grades 4 and 5, so that they can get their ratios down, and maybe we can get our grade level performance up. Just my feeling on it.
Thank you.
So our local budget, the budget for 21, 22, local current expense fund, you see here for county appropriation for operations is $30,350,000. That's broken down to what Moore County Schools has available to spend on their programs and staff is $27.3 million. The amount appropriated as a pass-through to charter schools is just over $3 million. Appropriating the $2.1 million in fund balance that I talked about there, estimated fines and forfeitures, and then estimated interest of $30,000 brings us to a total local current expense budget of $32,930,000. So for all funds for Moore County Schools, the original budget proposed is state funding $79,450,000, local current expense, which I just mentioned, $32,930,000. Our federal fund, Fund 3, which includes our ESSER 1, 2, and 3 funding and any other COVID-related funding that has come down from the federal government at $21,255,000. Our capital expense from the county at $750,000. Our school nutrition program at $5,485,000. And then our local operations, which are our local special revenue, our grant reimbursements that we've talked about, of $3,226,000 for a total overall budget for 2021, 2022 of $143,096,962. So just a summary of what's included there, and I just mentioned a little bit of that. It's an overall increase of the original budget from last year of $11.5 million, and the majority of that funding is related to our ESSER, the elementary and secondary school emergency relief, and the GEAR, the governor's emergency education relief funding that he had at discretion. We've got some money from the governor. Counting funding remains unchanged from the prior year. There is an increase in the local budget from the prior year, that $2.1 million that I mentioned, that increased estimated fixed cost. The This will allow us to maintain the same level of service that we've been able to provide in prior years. The class size reduction in K-3 has been fully implemented this year, and our program enhancement teachers that we were getting additional money over 4 years has been phased in, fully completed this year with the implementation of the K-3 class size reduction. We are continuing to get school resource officer grant funding from the state of $133,000. As I mentioned, I had revised that fixed cost increase. There is an estimated state increase for teachers, instructional support, and assistant principals in the budget. There's estimated state salary increase for central office, classified, and principals. There's also estimated state benefit rate increases, the 23% retirement and $7,000 in hospitalization that I mentioned. We were able to implement the classified salary scale as part of this budget. We have continued to shift or remain having some previously locally funded positions shifted over to one-time ESSER funding, which is the equivalent of 9 teachers, 2 assistant principals, and 2 instructional support full-time equivalent personnel. Estimated $800,000 to $1 million to use up all our ESSER 1 funding. There is increased charter school flow-through funding, the $328,400 that I mentioned, for a total of $3,040,000. This is approximately 1,376 students, and Dr. Grimacy mentioned a true-up or possible true-up. That'll happen later on in the year once we get more charter numbers. We have received 1 round of billing from the charter schools so far this year. The General Assembly passed a law which limits what we can ask for from the charter schools. It directed DPI to put in a process of how we transfer money to the charter schools. So that process has changed this year. So we're a little late on getting billing from the schools because of the new implemented procedures. And it appears that we're going to be less, if the trend holds true based on that first month billing, that we're going to be less than that 1376. So the charter transfer may not be as high as what we have estimated based on that first month billing that comes in from the charter schools. And I will note that first month billing is typically the highest of all the months, and then the charter numbers trend downward. The second month may be even, may go up, but typically it's a little bit less, and it'll trend downward throughout the year. So we may have a little less than that, but that's what we projected initially based on numbers we had from the charter schools. An additional summary, we are able, it does include a continuation of one-time COVID funding, that ESSER 1, 2, and 3, and then some gear money. And I just want to remind the board that all that has to be spent on responding to, preparing for, and or reducing the spread of COVID-19. So it's not just we can do whatever we want to with that money. So what we still don't know, that's not included in the original budget, what the actual state budget is, what actual salary increases for staff will be, what the actual benefit rates are going to be. We don't even know what our federal funding numbers are at this point for our normal programs like Title I and so on. And then something else, we're not sure, we've heard talk of, will there be additional COVID funding dollars from the federal government? So those are things that we don't know, that aren't actually trued up in this budget that we presented today. Before I get to questions, I do want Charles to pull up the support documentation information that was part of the executive summary. So if you pull up the executive summary, Charles. And then scroll down, click on that support documentation link. What this is, as he's pulling it up, this is just a overview of where we've broken down the funding by program report code for each of the funds. The Fund 1, I know it's very small there, but you have that as part of your documentation, and you can enhance it. But each fund has a slide or a sheet here that breaks down where this funding is by program report code, for your information there. So I just wanted to mention that as well. And at this point, I'm happy to take any questions, that you may have.
Thank you. A lot still to be determined since we wait on others to take action.
Correct.
Other questions for Mr. Cox at this time?
Just
Mr. Hensley?
One quick question. So this, what you just presented does not incorporate the $1.4 million in the COVID testing grant?
No, it does not. At this point, no, sir.
Okay, very good, thank you.
Other questions?
Is that like a net zero? In other words, do we anticipate paying out any local funds for that? That may not be covered, say, by the federal government or whoever, excuse me, the state government?
You talking about the 1.4 million?
1.4 million.
No, it's supposed to be a net zero where there is no funding from the school system at all. It's supposed to be a reimbursement grant from North Carolina Department of Health and Human Services to cover all the costs associated with this program. And there's also even indirect cost as part of that budget, meaning they're paying us to administer that grant, as we talked about what indirect costs are in that line-by-line budget review.
Okay, and one additional thing, going now from memory from our last presentation on this line-by-line thing on the budget, which I guess is also up there. You had about $550,000 in therapists. What is that for? Who are the therapists? And maybe you don't know that offhand.
Most of those are going to be related to Ms. Bullard's area and the exceptional children's area. But off the top of my head, I can't tell you specifically who they are and what program they serve, but the majority of those are going to be related to our EC services area.
That would be occupational therapists, physical therapists, behavioral,
Speech language.
speech language.
Okay,
you know,
all right.
that umbrella.
All right, so it's not psychological therapy or it's things like that? Am I
No,
correct?
sir.
No,
All right,
those-
that's-
those would be
I
listed
wanted
as
to-
psychologists.
I wanted to know that. Yeah.
Psychologists have a specific line item in the budget. And if you go back to that line-by-line item, you'll see the psychological services line there.
I can study that further. I just needed that clarification.
All right. Thank you, Mr. Cox. I believe you're still up, though. We move now to item 2D, the approval of the 22-23 budget calendar.
Click on the third tab over you got up there, I think. Try that. There you go, perfect. All right, so what this is just a preliminary budget development calendar. We do this each year, listing out important dates as we go through to develop the budget for the 2022-2023 school year. So as you see here in November, we bring the budget calendar to the Board of Education for approval during the December through June timeframe and ongoing. We have conversations with the different superintendent's advisory councils within the district, present budget as it's being developed to them, gain their feedback, and taking any considerations there. I just put January here because we anticipate multiple meetings, just like we did last year with the superintendent's budget committee, having those meetings and discussions leading up to the presentation of the superintendent's budget. Again, in January, on January 27th, we anticipate holding the plan is to hold a all-day, well, not all-day, full board work session on the budget to bring the feedback that is from the work that has been done by the superintendent's budget committee in January. Typically in January, and it's too early for the county to have developed their schedule, they have a county work session on the county budget where in years past they have alluded to what amount of funding that Moore County schools will receive. Over the last couple years, they have not done that. So we'll just have to wait and see if that trend holds true or not. But they typically have a county work session on the budget in January. March 7th, there'll be a during the board work session, will be the superintendent's proposed budget. On March 14th, there will be, as part of the school board's regular business meeting, part of that meeting will be for a public hearing on the budget, where the public can come and express their views on the proposed superintendent's budget. And then typically the next day after that, we open the web portal where the public can go and provide their comments on the web for those who did not come and speak at the public hearing. On March 28th, during the board work session, we'll present the revised superintendent's budget. What this will consist of is feedback from the general public and that portal that was open to the general public, and we'll do a revised budget if necessary, bring back to the board there on March 28th, and then on April 11th, that's when the Moore County Schools Board of Education will adopt the budget as their budget at that time. In April, again, working with the county to true up a date, we'll present the Moore County Schools Board of Education budget to the county commissioners. In May, the county commissioner typically presents his budget to the commissioners. At that point, we will definitely know, well, I say we definitely, history has shown that at that time, we'll know what our level of funding will be from the commissioners. And then in June, at some date, they will have a public hearing on their budget, the county commissioner's budget. And then June 30th, they have to have, is the deadline by law for the county commissioners to have their budget passed. We typically like to come back to the board by October with a original budget resolution, because we know that the state has passed their budget. We're a month late on that this year, just because of the flux of what the state budget will be at this point. So here's the proposed budget calendar for the development of the 2022-2023 Moore County Schools budget. Happy to take any questions at this point on the calendar.
Are there any questions about this? Hopefully, when we begin in starting on this next one, the people in Raleigh will have given us this year's budget, and it will make it a little bit easier to work toward the next year.
I hope so, yes. I agree with that.
And obviously, dates will be added in there as soon as they become
When they
available.
become available, yes, ma'am. That's correct.
Any questions?
Mr. Cox, given that I think we're still committed to a zero-based budget, so what, it's really a compound question, so what's different between last year's budget process and the upcoming year's budget process? And what level of information are we asking the cost centers to provide, and in what format are they going to provide that information? I.e., how are we going to start, get a budget from scratch?
Right. So there's, so on a large scale, there's really nothing different with this timeline for the development of the 22-23 budget. Internally, the budget managers had to provide to me their budgets, which included an increase, which included a held harmless, which included a reduction, starting from scratch. They had to provide that on October 15th. The senior team is currently in the process of reviewing those budget requests. We'll have further conversation on those. We'll work with the superintendent later on in November to kind of come up with a little better idea of where we are with the budget as we start preparing the information to bring to the superintendent's budget committee in January.
Can I offer a summary statement? You must start from zero, justify everything, make no assumptions, and from that, budget for that, for you to get the same exact amount, budget for an amount less than that, retraction budget, or then if afforded the opportunity to identify potential for growth, then recommend that. That is different than what we've done in the last few years.
Okay.
And you all are happy with the progress and formats and whatnot?
At this point, yes, sir. Since it's, we've worked toward implementing zero-based budget and haven't got there in prior years. So we are further along than what we have been, and at this point, yes, we are satisfied. We'll see what the outcome of the work later on in January.
And I'll let you know after I hear from Mr. Cox.
And I guess my other question is, at what level do the budget submissions start? Does each school submit their budget for their number of positions, or is that managed here at the central office?
Okay, so Dr. Locklear's team manages, they have formulas that generate the number of teaching positions at each school. And so that is done here based on that formula. He does work with the principals. And then there is a true-up on principals, on positions after the 20th day, because it's initially done on estimates.
Right.
And then after the actual number comes in, it is trued up. So if we gave 2 positions too many to a school because of ADM, that is trued up later on in the process. But we also have to go talk about the challenges of that timeline. We're going on estimates of what DPI says they're going to give us. So that's what we're using when Dr. Locklear and his team are working with the principals on how many positions are allocated out to each school.
Yeah, and I would just amplify that last part there. Since about 80% of our budget is personnel,
Right.
most of the back and forth has to do with estimates about the number of students and the number of staff. When it really gets down to numbers of dollars, it's the staffing that drives the dollars. So I'd say most of the conversation is with Dr. Locklear and Dr. Metcalf and the principals has to do with how much we think we're going to need on the number of students and what the various needs of those students are.
The January thing is what date in January?
So the full board work session is January 27th.
That's pending your approval.
Right,
No,
yeah.
no, no,
That's what we're,
It's the
get
last,
that.
it's traditionally the last Thursday of the month.
Okay, January 27th looks like it's very, very close to February 1st.
Yes.
And,
Man knows how to get out of town.
that's right. Should it be?
That's purposeful, Mr. Levy.
I understand that. Should it be earlier? That's my question.
It always can be. Let me tell you why we've settled on that last Thursday. Ultimately, the superintendent offers the budget in that first week of March. And so getting the budget committee work done, you have to have a deadline for the budget committee. That is your 3 school board liaisons working with the superintendent, taking what the staff has put up, and sort of working the sausage, if you will, through the month of January, and then presenting what we call the factors that frame the budget to the board before you get an actual budget, so you can react the same way your colleagues on the budget committee have been able to do. Have a full day of that, and then the staff takes that input and over those coming weeks makes any final decisions, engages in final internal arguments about priorities in the context of school board feedback. But we also just need time for putting the presentation together. The packaging actually requires some time. So there's no magic to it, except that administratively, that's sort of the cycle that's needed for the staff to do its work to present ultimately a budget to the school board in the first week of March. So we can shorten that up, but what it does is it just puts more pressure on the budget committee to advance its work more rapidly.
I'll just leave that to your discretion, but it's, there's a problem with the give and take. There would be give, but not a lot of take.
well, and just to add on to what Dr. Grimacy said, last year we had 3 superintendent budget committee meetings, a week apart leading up to that full budget work session. So if we move it up, there's less work that budget committee, the superintendent's budget committee can do to prepare good numbers or good information for the full board. And again, not opposed to moving it up, but that's why it's typically that later part of January, so the committee can have time to do their work.
And let me, if I could just add, from a personal standpoint, all joking aside,
Yeah.
As I considered the date, what was the date by which would be most appropriate for the school district? I think there was one quote I had in the paper somewhere there that alluded to this. The pre-work on the budget sort of comes to that point the internal pre-work on the budget comes to that end point at the end of January. And February 1st tends to be a date by which the school board and the central administration is making increasing numbers of decisions that affect the following year. And it was my feeling, however the board wants to resolve my successor, be it interim or permanent, however, that is sort of the point in the year where we've sort of brought the analysis and the preliminary work to a point where I can hand it over to somebody, and the school board has the momentum, the internal staff has the momentum. And from that point on, the decisions are being made future-focused. That's the point where you want your new superintendent coming in the door. Instead of me making all those decisions and handing it over to that person then engages in that process. So from a personal standpoint, whether anybody agrees with me or not, that was sort of my own thinking that we had. And so I really had a personal responsibility to finish that preliminary work and then hand that over to somebody where I think they could then sort of monitor it without really having a dog in the fight. They would just sort of listen to the board, listen to the staff, and be a true facilitator from that point on.
Well, I appreciate that, so I guess the date is probably as good a date as.
It's what we recommend.
So, okay.
I also want you all to check your calendars for that day, because, really hoping we have all hands on deck.
After listening to everyone speak, look, I'm comfortable with the timeline. It seems like externally, the timeline's the same. What I'm really interested in, and the change is the stuff that happens up until January, the internal staffing and the format. Because if we are gonna do a zero-based budget, then what's the format gonna look like? What degree of fidelity are we gonna present it? And then, is the staffing done properly? So anyway, most of the stuff, as I said, seems like it's internal before January, the changes.
Are there any further questions? All right, thank you, Mr. Cox. All right, we now move to item 2E, first reading of some new and revised policies, and I'm going to.
Dr. Alpenfels is here right on cue.
Dr. Alpenfels just snuck into the room.
Lord Moore Band.
So we're going to go to Dr. Alpenfels and Mr. Levy for a look at these policies, and it was a lot of policies. Again.
Yes. But most of them are technical. Let me first of all say, I want to thank the committee consisting of Chair Carter and Mr. Dennison. We three were on the committee along with Dr. Alpenfels. And Dr. Alpenfels, I want to tell you once again how much we appreciate this extra work. Your title is head of HR, but you've also taken on this, which, I think is kind of extra in addition to HR. So I want to say how much we all certainly appreciate that. Did you want to say something, or do you want me to go over it?
Please proceed.
Okay, all right. So the changes, let me first of all say that I proposed 3 changes, all of which were not approved by the board. One of them was to set as a goal a lower student-teacher ratio over the next few years. The other one was to make sure that any student who was reading below grade level had a document signed by a parent acknowledging that the student was reading or doing math below grade level. And mandatorily had to talk with the teacher And, just one second. And also, which doesn't seem like it's as pressing as before, that we give to every parent a document where they can opt out of surveys. We have a lot to do today, so I elected not to bring those before the general board. I'll probably bring them either in December or January. But I think we need to talk about having a goal of lowering student-teacher ratios and making sure that every single parent knows if his or her child is reading below grade level and physically acknowledges that with a signed document. So at any rate, getting back to those things that were approved. Let me go through this. There is a change in the in the schedule of, in the way we define board meetings. These, by the way, were recommended, as I understand it, by the State School Boards Association, but we read them thoroughly. And it creates, we currently have two types of meetings. One is our regular board sessions, and number two is special board sessions. This has really three types of meetings. It's a regular board meeting. It is a specially called board meeting and an emergency board meeting. One of the things that we did preserve in this, which is different from the state board's recommendation, is that still two board members can call these meetings. So it's not just the superintendent or the chair or the vice chair, but two board members can also call the meetings. Going down to, and it defines what special meetings are and what emergency meetings are, and the key to emergency meetings is that they should be emergencies. They can be called at any time, but they're limited to the emergency meeting. In other words, the subject of the emergency meeting. We did get rid of this whole thing about public hearings. We haven't really held any public hearings, but it's kind of, you can still hold them. It's just not part of our school board's policies.
Yeah, well,
Yeah.
the public hearing issue is still in there because we will be holding public hearings such as the one for the budget that'll be coming up in March, I believe it was.
Yeah, but it's simply
and that's-
scratch the policy, the listening hearings.
Right, but that's included in the one that we're proposing.
Yeah,
All of that is included.
Mr. Levy,
Um,
what the policy committee has brought forward is really to consolidate 4 separate board policies into a single board policy.
yeah. Right.
So we have it all in here.
No,
Just brings it all together.
okay. So I'll stand corrected, the public hearings is in there. Keeping on going here.
So technically, you're not getting rid of anything, you're just consolidating into one
Correct.
policy? Is what
Correct.
it is, okay.
The School Boards Association has a single policy about board meetings. and the policy committee is recommending consolidating our 4 very old separate policies into
Into
that
one.
single policy,
Makes sense.
with some minor revisions.
And
Madam Chair, while Bob's looking at the other one, you know, this one got a little complicated, and because we had so many policies to cover, I would really like for us to look at this one again, to go over it more thoroughly, because I even, preparing for this meeting, I don't know if anybody else feels the same way about it, but, I just,
You talking about E? Number E, letter E?
no, I'm talking about the whole policy, just
The
to
whole
review
policy.
it
The
again,
whole
since so
policy on
much was put
meetings,
together.
correct.
I'm sorry?
The whole policy on meetings.
Yes.
Yes.
yeah.
1310.
Give us a
13,
chance to
thank
look
you.
at it a little
Title
deeper,
Board
and
meetings.
Okay.
if that's agreeable with,
we could theoretically pass on all these, most, except for the people on the committee, you've only had about 2 days to look at these policies. We could pass on these policies, and hold them until our next, until our regular board meeting. And it only means that we'll be delayed because we have to pass them twice. So it would mean that we would be delayed until December in passing them in their entirety, but none of them are emergencies.
right.
So if it's the feeling of the board that you want some time to study these policies,
Well,
I'm not against that.
Yeah, I was just talking about the meeting policy. The other
1310.
ones look fine to me.
Well, I'm also asking other members of the board, if they've had a chance to go over this. Because I think you're either gonna take them as a whole or amend them. I mean, how does the board feel?
All of them really, as Dr. Appenfeld said, that they appear to just have minor revisions from what I saw. So if Mr. Dennison is suggesting that we possibly pull this one, and vote on all of the others, maybe that would be the next best option.
So, I mean, that's fine with me, however the board wants to do it. I mean, I'm not, let me continue to go over these.
Well, I guess I could, Mr. Levy, if I could. So what's the process? There's 2 readings on them, then we vote to approve. So we would vote to approve these at the next week.
Typically.
Correct.
yes.
But we could, to Mr. Dennison's point, we can make a motion to approve all of them except, say, this one, or
Exactly.
maybe there's another one
Right.
of interest, so we could
Exactly.
pass the boilerplate ones
Yeah.
that no one
Yeah.
really,
Right.
yeah.
Yeah.
Yeah,
And
just
then-
remove this one, and the rest of them look good to me.
And then the
That's okay.
determination needs to be whether the ones that you're pulling, are they going back to the policy committee, or are they just to be reconsidered by the full board? I would need that direction.
Understood.
I think, Mr. Dennison, are you asking that it be returned to the policy committee?
Right.
Okay.
To see if we find things in there, and then
And
we
then
can
bring it
bring
to
the
us.
specific changes we made give them to the rest of the board, and they can review it too.
And also, in the meantime, board members have the opportunity to review it and submit their thoughts to the committee, Mr.
Right.
Levy,
Right.
so that you can discuss that while you're meeting. And then that way, it's pretty all-inclusive once your board approves it.
Well, that's fine. I mean,
Yeah.
I'm not wedded to any of this, and if Mr. Dennison has some misgivings, I'm
Yeah.
all in favor,
But-
of going along with his misgivings.
What we could do too, Bob, I mean, we don't have to wait till we have 100 pages of policies. We could do this one relatively short, period. We wouldn't have to wait till we have a zillion of them to do it.
So you've already got a zillion on your next agenda.
And by the way, do you have those, or do you already have those new policies?
I actually have some other sections of policies that staff and I have been reviewing that I'm prepared to bring at the next meeting.
Okay.
So
Okay, so
part of the
maybe we
ongoing
can,
Put
maybe
this
we
in.
can meet, not before the business session, but between the business session and the December meeting. Would that be okay with you, Mr. Dennison?
Yes, sir, be
And
fine.
Ms. Carter? Okay, And then we can go over those policies. It's my understanding also that we're waiting for the state legislature to conclude their session. Because when they finally enact their budget and everything like that, there may be additional policies which are coming up, okay? So let me also go through this for a second. There were some minor revisions to reading camps, yeah.
I've got another revision before you get
Okay,
to that one.
all right, sure.
On 1326, the public address to the board, I maybe didn't state this as clearly as I thought I did at our policy meeting. It read originally, if additional time for public address is needed, a second 30-minute comment period will be included at the end of the agenda. And what I had asked, because we haven't been including it at the end of the agenda, is that we strike those words at the end of the agenda, such that it would read, if additional time for public address is needed, additional time may be included.
Got it.
Period.
Yeah, and we're doing that because, you know, we don't want to have people making public comments after we've already covered items on the agenda, so.
Right, so it would continue in the vein that we have,
We've been
already
doing.
begun, which means we hear everybody who's speaking earlier in the evening rather than after, we've
And-
already voted on
If-
things.
And while we're talking about revising this, since we're, because it's something that I wanted to revise later on, that policy does say, and though this is not part of the revision, that they must talk about what's on the agenda. Quite frankly, some of the most interesting comments that I think we get from the public are things which are not on the agenda.
I don't
So,
think it says that.
I believe it does.
I think it's that we give preference to the speakers who are talking about items on the agenda.
On the agenda, we should probably strike the words "on the agenda." Because as I truly read through this, that,
All right, well, I would ask that we pull this one then too, so that we can send it back to the committee.
Yeah.
Yeah.
That's what I was gonna suggest.
Okay.
because as I do say, the whole idea is to give the people
Give
the
them
chance
opportunity.
to say something, and sometimes
Whenever they
it's,
want.
they want to talk about buses, and we say,
Yeah.
oh, yeah, we didn't know about that,
Yeah.
you know?
Another benefit would be too, if we're gonna listen to all the comments before we have, take action on what's on the agenda, we won't need that part about, we'll give preference to people who are gonna talk about an item on the agenda.
Right, and one of the things that I think we need to compliment our board about is that I see on television a lot of boards saying, well, that's not on the agenda, you can't talk about that. And people get very, very upset, you know? So
Okay.
we're very free with that.
Okay, great.
So we're gonna pull those two items, okay? And so am I down to reading camps?
No,
Where am I?
you should be,
It may not be necessary,
Yeah.
Mr. Levy, to walk through every one of these.
Yeah.
Because
maybe
it-
we could just see if any members of the board have questions or concerns about any of them that are on there. Because for us to go through each one of them individually is gonna take a
Okay,
long
that's
time.
fine.
So if someone's got a concern about a particular policy, now would be the time to speak up and ask about it. I don't have any concerns about any of the rest of them.
What you could do here is, you know, this is what it says, so they are, but there are very few changes.
Yeah, and there is one other thing, and is that, one of these days, I would like to see the words reading camps changed to reading and math camps. But that's a budgetary item, that we might take a look at. So does anybody else have misgivings about any of the other items?
I don't,
I do not.
Okay, then I would propose on behalf of the committee that with the exception of those two items, that we do an initial approval of the changes in the policies.
first reading, yeah.
Okay.
No need for action, Mr. Levy or Madam Chair, it's just your first reading today, and then your second reading is when you take action next Monday.
Right.
Okay,
Correct.
Easy enough, just board consensus.
All right.
Sounds
And if you do, as you're reading through these in the course of the next week, if you had not had a chance to get all the way through them, email Mr. Levy and let him know if there is
Yeah.
something that might come up.
and Dr. Appenfels, before you get away, and you don't have to answer this because I didn't prepare you at all, is it? I really would like to know whether FICA is mandatory for a school board. And I know that in certain situations for government workers, it is not. It may be mandatory now, I just don't know. But if you could let me know that, I'd appreciate it. Thank you.
All right, let us move now to item 2F. Again, we'll go back to Mr. Levy. This is a proposed resolution. Mr. Levy?
Yes, let me go over to the resolution. Yeah, I've got it here. Yes, I think that everybody is familiar with the fact that the Attorney General of the United States, based upon a letter from the state school boards, has issued a memorandum, and that memorandum has ordered the FBI and basically the entire Justice Department to start investigating parents who come to school board meetings and has, as a matter of fact, the statement from the National School Boards Association is to investigate them as terrorists or investigate them under the Patriot Act and the like. What this resolution does, and it can be read, and I'm sure everyone has read it, it says that we do not need, here in Moore County, we do not need that kind of law enforcement. It says that if there are any threats, our local law enforcement is more than adequate to take care of it. But more importantly, it says that this board, as part of the therefore clause, that this board takes exception to the recent communication of September 29th, 2021, from the president of the National School Boards Association, and that such sentiments as that do not reflect the position of the Moore County Board of Education, which supports the freedom of every American to exercise the right to free speech, the right to petition government for the redress of grievances, and the right to peaceable assembly. I believe that our board needs, we're going to go to the State School Boards Association convention next week. And we need to take a strong position, both for the State School Boards Association and for our public, to say that we want parents to come here and express their grievances. We want parents to come in and tell us right or wrong what's going on, and we want them to be involved in their children's education, and that we take exception not only to the state school boards, the National School Boards Association, but I might add that we need this resolution, because in our agenda for last month, we had all sorts of letters in that agenda saying how there was so much violence going on. And we had the governor's letter, we had the attorney general's letter, we had the National School Boards Association letter, we had the State School Boards Association letter. And I think that one of the things that we have to tell the public is that we don't join in that kind of mass hysteria, and that we welcome the people to come in and talk to us, and we won't call them terrorists, we'll call them good parents. So I would ask that the board pass this resolution and send it on to the governor and to the Attorney General of the United States, as well as our state representatives. Submit.
Thank you. Are there questions or comments for Mr. Levy concerning the resolution?
Well, I was just gonna say, I guess I took it a little bit different. I think that parents always have the right to come here and voice their opinion, but to me, it's unacceptable for anyone, parent or not, to threaten anybody, even before, after meeting, or parent to parent, or person to person. It doesn't have to be us necessarily, but I think that's unacceptable behavior, and it shouldn't be tolerated. So I guess I just took that differently than what you're proposing. So I necessarily don't agree with everything that's said in that proposal that you have.
Well, the one thing that the proposal does not say that if there's if there's violence or something like that, that we're somehow to take that lightly. But quite frankly, I haven't seen any violence. The only thing that I've seen here in Moore County is a lot of parents with a lot of differing opinions, both on one side of the opinion, both on the right and on the left. And all this is saying is we welcome all of them. We welcome every one of them to come here. And by the way, this says peacefully. This says peaceable assembly. And unfortunately, I think we're too polarized to that somehow if a parent comes in, they're going to be scared that they're going to be considered to be a terrorist by the federal government, or they're scared that they're going to have the FBI on their tails or something like that. What we're saying is no, come here. And we're also saying one other thing. We're saying that we have confidence in our own law enforcement to keep us safe. And quite frankly, I don't feel scared in the least at any time. As a matter of fact, what I think we're doing here in Moore County is we're creating many opportunities for people to speak. And the more opportunities we create for people to speak, the less of a chance they're going to have for getting upset. And this is taking a stand to say, especially to the Attorney General of the United States, who never withdrew his memo. Even the National School Boards Association apologized for part of their memo, okay? But the Attorney General of the United States has not. And they're still today, trying to label parents as terrorists or as violent or something like that. And quite frankly, I mean, I haven't seen any violence, okay? I have not seen any problems here in Moore County, especially. And I think we need to take a stand and tell the public that.
I actually agree with Ms. Caldwell, and will add additionally that we have our policies, protocols, procedures in place to mitigate against people just coming and just acting out. I would suggest that if we want to go to a next level, that possibly we have our legislative committee, Mr. Dennison, Mr. Levy, and I think Mr. Hensley, to take a look at this and maybe begin with our state board. You guys mentioned that you would be, I think, in Greensboro next week, so discussing and possibly getting on the same page at our state level may be a next step, but I just don't see us at this point in time having a role at the national level with this type of resolution.
Are there further?
What was that? I'm sorry.
We could
Oh,
just,
yeah.
we could just,
You figured that out.
you know, we
And
could
we
just,
will include Dr. Locklear as well.
Well, I'll tell you how you can help later on, Dr.
Android, that was not me.
Okay, so it wasn't Siri. For those listening online, we had a voice from a phone ask how it can help. Apparently, another form of Siri wants to get into the action. But, yes, and we could use help, I'm sure. I think, Mr. Hensley, you had a comment.
yeah, well, first, in reaction to that, we could just pass a resolution to delegate all our powers to Siri, and then we could just put a Siri on Dr. Grimacy's desk, and Siri, what do I? Okay, so a couple things. One is, and this was on the last resolution too, we need to correct the aspect ratio of our logo. Our last, if you scroll up a little bit, our logo is short and squatty. And it was the same thing on our last resolution. If you look behind you, it's a circle. If you look up there, it's an oval. Anyway, just a minor administrative. And I'm,
Picky.
and I'm, well, it's, I mean, it reflects on our district. And anyway.
But let me do one thing.
Well, hold on, Mr.
Yeah,
Lee.
go.
I got some more serious points.
Okay.
Anyway, yes, that, and our last resolution was the same way. So, couple discussion points here, to Ms. Caldwell and Ms. Thompson, really everything. It's worth noting that a large number of states, and I forgot how many of it is, but I think it was more than a handful, and I think around a dozen. There's a large number of state school board associations who have either parted ways with the National School Board Association or threatened to part ways with the National School Board Association. So, and as Mr. Levy said, the National School Board Association has apologized or recanted part of their letter in response to a large number of state school board associations renouncing it and saying, we're going to quit, right? So this is a major issue, and the National School Board Association clearly overstepped their bounds of appropriateness. The other, if we step back a little bit, I would say that we as a board in the coming year, we need to take a look at these organizations that we're members of and we pay dues to. There's the State School Board Association, there's the North Carolina High School Athletic Associations, there's all kinds of, there's a handful of that I can think of off the top of my head of groups and organizations that Moore County schools are members of, that we pay dues to, and I'm not so sure that the goals and values of those organizations align with the goals and values of Moore County schools or our county as a whole. So I'm not so sure we should be members of the North Carolina School Board Association, but we certainly need to, as part of an ongoing periodic assessment, we need to assess that and discuss that. And I'm not saying that we do it in context of this resolution, but you know, there are things that they do and there are things that they say that I raise my eyebrows at, and I'm like, yeah, that's not in step with Moore County. So no action required on that, just two observations.
I had better formally propose the resolution and seek a second on it, which I do.
Well, we would take this for action next week, right? I mean, there's no action required. This is a pending action.
Okay, so this would go on the agenda for next week, is that, okay, that's fine,
Pending
that's
act-
fine,
as an
okay,
action item, yes.
all right.
Are there other questions or comments concerning the resolution? All right, Seeing none, then we're actually just a trifle ahead of
We are,
schedule.
Madam Chair, legal counsel's available at noon,
Okay.
and so we do have time to, if we could leapfrog over closed session and board action, could we go to, we don't have Mr. Brath in the room. He's watching on video. He's supposed to know if he's queued up. Let's see, Dr. Locklear, student surveys is gonna be, that'll be a long conversation, okay.
Actually, it might not be, because we're not gonna go forward with it.
Let's see how it works, and then if we need to continue the conversation after lunch, we can do that. Dr.
All
Locklear?
right, so we're gonna move on to item 5D.
Yeah. Okay.
Status of student surveys. Okay.
We still need to, confirm what's gonna be on consent.
No, ma'am, no, we don't. We're gonna come back to that later. Yes, ma'am.
All right, Dr. Locklear.
Yes, ma'am. So, very quick, I'll try to move as efficiently as I can through this information, but as you're aware, on September 22nd, regular monthly meeting, the school board gave its endorsement to seek parent community feedback on the administration of the following surveys: the social-emotional learning survey for grades 3 to 12, and on the school climate culture survey, grades 7, 9, and 11. As will be noted here in the presentation, a link on the MCS webpage was created that provided an overview of each survey, copies of survey questions, and a portal for parents to provide their online feedback, and I'll give some summary information on that here in a few moments. District also sent out a school messenger communication to our parents, to that they can review those survey questions, provide feedback in a portal for a 2-week period. Parents were also informed that hard copies of the survey information and questions were available in the school office, and that feedback could be provided to their school principal or directly here in the Moore County Schools Office for Student Support Services. Something seems to be happening with the presentation, so I'll let that get pulled up, but again, just a little more information about each of the surveys and the timeline that was proposed. The first survey that was proposed, here we go, it's working now, November 2021 was the social emotional learning survey. The proposed delivery method was online through the Panorama Education Survey platform. The proposed participating students were all grades 3 through 12, grades 3 through 12. 36 elementary and 40 secondary questions from SEL competency categories. Those SEL competency categories are grit, growth mindset, and social awareness. And then there were questions from the supports and environment categories of teacher-student relationships, school safety, sense of belonging, and engagement. And just as a reminder, grit, growth mindset, and social awareness are not anonymous. That we do get information back on how the kids rate themselves, their perceptions in these areas in grit, growth mindset, and social awareness. Participation in the survey, as all our surveys, are voluntary, and parents may always choose to opt out their child on any survey that's given. The second survey that was proposed was the climate culture survey. The delivery window, or proposed delivery window on that one, was going to be April-May 2022. Proposed delivery method was online through the Panorama Education Survey platform. The participating students in this survey, the climate and culture survey, is 9th, 7th, and 11th graders. 7th graders, 9th graders, and 11th graders. There's 37 questions from categories including demographics, equity, school climate, and school rigorous expectations. As in the other survey, participation survey is voluntary, and this entire survey, the climate and culture survey, is anonymous. This is an anonymous survey in totality. As always, parents may choose to opt out their child. Again, the process for seeking community feedback, already covered that in the review of the executive summary, and now it's giving me an error again, but the response that we got back, if you look at the, if you happen to be able to pull it up on your computers, you can see, let's see, it's not letting me advance, Charlotte. We had two charts in the presentation that notes the total number of feedback that we got and how that was balanced out through the presentation. The SEL survey, we had 134 responses, and that was a pretty balanced response from the community and from our parents. We had about 55 of those responses that were positive or approved of the SEL surveys. We had about 56 of the responses that were negative or disapproved of giving the surveys. Had about 9 that we describe as nondescript, or neutral, if you will, in the feedback that they gave. About 13 of the responses didn't have any response, and 1 was a duplicate. So that was a total of 134. For the climate and culture, yes, giving us error for some reason. Climate and culture, we had 81 responses on the climate and culture surveys. We had about 35, again pretty balanced, about 35 positive or approved of those surveys. We had about 34 who were given negative or disapproved of. So again, pretty balanced. 9 nondescript there, again kind of a neutral, there it is, kind of a neutral response. 2 no responses and 1 duplicate for a total of 81. Go to the next slide. Additional feedback that we received not through the portal. We had 1 principal report receiving feedback from a parent stating their approval of the SEL survey and disapproval of the climate culture survey. We had 1 parent contacted the Office of Student Support Services here in the county office, communicate their disapproval of both the SEL and climate culture surveys. We had a number of online survey responses, offered feedback, suggestions related to improving the surveys, some of which included using open-ended questions instead of a Likert scale, eliminating ethnicity and gender-related questions in the climate culture survey, or shortening the surveys and eliminating repetitive questions. And the feedback we received the most of is the observation and suggestion that was shared that the SEL survey was not age appropriate for 3rd grade students, and that was probably one of the suggestions we received the most of, and certainly it's worth additional consideration. Next slide, just kind of the highlights of, we tried to pull out repeated themes of concern or repeated areas that were repetitively in the feedback or areas of concern. Those were survey questions are invasive and intrusive. Questions or concerns about the privacy of students, the privacy of data held by Panorama. Panorama and SEL promoting critical race theory. The 4th one, use of Panorama violates FERPA, which is the Federal Education Rights to Privacy Act. And then the last one, the survey questions promote racism and discrimination. These are some of the repeated themes or areas of concern. And we try to run through and give some responses to each of those areas of concern. So the next slide notes the survey questions are invasive and intrusive. The SEL survey questions and format are research-based and have been determined to be valid and reliable measures of SEL competencies in school supports and environment. The climate and culture survey questions were developed in collaboration with board attorneys as a tool for gathering targeted student feedback related to school climate and culture on an annual basis. All of these surveys are voluntary, and students are not required to participate if they wish not to. In addition, parents may opt out their child from taking either of the surveys if they desire. Go to the next slide. The next repeated area of concern and some information in response to that. Privacy of information and data held by Panorama, that concern there. Moore County Schools owns the survey data served by Panorama. The Moore County Schools contract with Panorama does not allow them to share or sell school district data. The contract does give Panorama the ability to use aggregate, de-identified information culled from survey results. This is information that cannot possibly be traced back to individual students and is used for benchmarking purposes. An example of that benchmark purpose would be to use the data to create the national benchmark related to survey categories. The contract does not give Panorama the right to use any personally identifiable information about students, anything that can be traced to a specific student by name, ID number, or otherwise, except for doing what we as Moore County Schools is asked them to do in terms of collecting and reporting survey responses back to our designated staff. this area continued, the privacy of information and data held. Panorama follows best practices for data privacy and security. The company implements administrative, technical, and physical security controls designed to protect information stored on its servers, which are located in the United States. Panorama does not use student data for purposes other than serving schools and districts, and cannot share any education or student information unless authorized by the school or district under applicable law. The next area of repeated concern, Panorama and SEL promote critical race theory, CRT is commonly known as CRT. Panorama Education is not affiliated with any particular academic or legal philosophy, including critical race theory. Panorama is not connected to CRT and is not a tool for teaching CRT. Social emotional learning as defined by Moore County Schools is teaching students to understand themselves and others so they can self-regulate their emotions, behavior, and relationships to make responsible decisions and be successful learners and eventually citizens. SEL does not promote CRT, and the skills SEL supports are comparable to what we would call soft skills, sometimes referred to as employability skills, such as initiative, flexibility, teamwork, collaboration, and problem-solving skills. That's really how we define in Moore County what SEL is, and we'll be talking a little more about that on Thursday when we're talking about the main two of the board's strategic plan and updating you on that. This chart that we've included here is a visual that we've created to help express our definition in Moore County of SEL. When you look at the SEL competencies, self-awareness, grit, growth mindset, and self-management, on the right side of that graph is connecting those to the employability skills or soft skills or citizenship skills that those SEL competencies are helping to promote. So grit, self-awareness, growth mindset, self-management would be linked to building professionalism, strong work ethic, initiative, cheerfulness, flexibility, adaptability. When you look at social awareness, relationship skills, those are keen to or connected to communication, teamwork, collaboration, friendliness, politeness, kindness, helpfulness. And when we think about responsible decision making, those are connected to leadership, ethics, problem solving, resource management, trustworthiness. And then the two more repeated areas of concern. Use of Panorama violates FERPA as defined by the Moore County Schools Panorama contract. Panorama follows all laws related to the Family Educational Right to Privacy Act, FERPA, the Protection of Pupil Rights Act, PPRA, and the Children's Online Privacy Protection Act, COPA. And then finally, the last repeated area of concern, the survey questions promote racism and discrimination. The climate culture survey questions were developed as a result of an Office of Civil Rights, OCR, investigation in 2013-14 related to a claim of discrimination. The survey questions were accepted by OCR as a strategy to learn more about student experiences at school and promote non-racist discriminatory behaviors. The questions are not racist nor discriminatory and are valuable in determining the climate of the school for people of color and if discriminatory practices may exist. And then as we wrap up the presentation, I wanted to hit a couple of the repeated areas of support. These are 5 bullets that just sum up some of the repeated themes of folks who, the feedback that received that was positive and supportive of the surveys. I see nothing wrong with the survey questions. I have no issue with the survey questions. Understanding the social emotional needs of students is important. Student perceptions of themselves and their school experiences are important. The surveys help to support students and improve the learning environments in schools. The surveys help to identify areas of concern and the opportunity for improvement. And then, as was noted on the executive summary, based on the collaboration with staff, the superintendent has decided to pause moving forward with the recommendation to administer the SEL and student culture and climate surveys at this time. Staff will use this pause to continue to review the feedback, look where it may be appropriate to revise questions, delete questions, etc. And then staff may bring back revisions to the current surveys for the board's and community's consideration and feedback as would be appropriate at a later time. And that concludes the presentation and review, and certainly open to any additional questions or discussion.
All right, thank you, Dr. Locklear. Are there questions directly related to the pausing of the survey administration at this time?
And just let me say, there are a number of things that I would take issue with on the presentation, but I'm not going to do it at this time, because the recommendation is to pause everything. So I think it's probably much more valuable for me to, and for maybe the board, to take a look at it if you decide to bring it back. But I just wanted to register that I have at least I take a lot of exceptions to the presentation, but I don't want to belabor it right now because I don't see as it helps us at all.
Thank you. Any other comments or questions? All right.
I just.
Go ahead, Ms. Thompson.
Thank you. Given the controversy, and of course, we've had positive feedback, and we know that we've had lots of speakers who have come and expressed their concerns, and so I agree, and I think it's just a good decision at this point to just, as you've indicated, pause and just take a look at it. My question would be, Dr. Locklear, with this survey, do you know of, based on our questions, where over the past there have been positive outcomes relative to identifying our students with suicidal ideations or concerns who have led to intervention with those students? Would you happen to know?
I'm gonna let Ms. Dedman respond to that and give a little information how we screen for that at the secondary level, which we're required by state to do that. Ms. Dedman.
So the Panorama survey is not a way to find suicidal students. This is more about their social skills, how they feel about themselves, how comfortable they feel about the school environment. We have a program called Signs of Suicide, which is suicide training, how to be aware of suicide, and then that's where we find our screening and do follow-up with that. So the Panorama is not that vehicle.
I knew that it was high level and it did not get to that degree, and I didn't know if those emotional questions prompted any type of second look. So
well,
thank you for
there certainly are other advantages to and positive outcomes. For example, when we look at some students who report that they feel like they have no competencies, as we talked about, then the counselors can pull those students in to do some counseling groups with them and some skill building with them. And so that kind of thing is certainly a positive outcome. Another positive outcome is it's a great way for us to measure our efforts. So knowing, like, for example, you'll see this on Thursday, knowing that we have had some positive outcomes because of capturing kids' hearts, we can use the Panorama survey to measure the climate and the culture and the relationships in the schools. So it's a good way for us to measure what we do, and it's a good way for us to know how different students feel about the environment, and do we need to make some changes in terms of the comfort level of our students in the schools.
Okay, thank you.
Mr. Hensley.
Since it's almost lunchtime, actually, I agree with Mr. Levy. I would have objections to this, and it didn't fully address the concerns I articulated when we talked about this several meetings ago in relation to student privacy and data and all that. However, in recognition that the superintendent's recommending that we put a pause on this. I'm sure that all those factors went into the superintendent's calculus. So, you know, when or if this resurfaces, you know, we'll see what's been addressed and what's been fixed, and we'll see what the proposal is at the time. So I have nothing to say other than that.
All right, thank you. Anyone else? All right, thank you, Ms. Dedman and Dr. Locklear.
Madam Chair, before you go into closed session, the clerk and I were recommending that board members would secure their, get their lunch and bring it back. You would adjourn into closed session, allow everyone to get their lunch and bring it down here so we have room to spread out a little bit. And legal, by then, Ms. Potter will have legal counsel on the phone. And so if you can take, once you vote to adjourn to go into closed session, if you take a 5 to 10 minute transition break there for people to go to the restroom, clean up, get their food and come back, that's what we would recommend that the board
Are we
consider.
having closed session here?
Yeah, we're gonna go
Okay,
ahead and
all
clear
right.
the room and bring, you know, everyone get your food, bring it in here and do it here rather than, you know, all be crammed into the conference room, unless the board prefers to do it the traditional way.
No, here's fine.
Okay.
All right, at this time, I'll entertain a motion to enter closed session.
Mr. Hensley's got a question.
The only objection that I have to having the closed session in here is the possibility that it may accidentally get broadcast.
No, it'll set where it's just like a splash screen with no volume at all.
Understand?
Yeah, I questioned that earlier, and I've been assured
Okay,
that it will.
Okay, if we're
I
sure
was
we
given
have
that
positive
assurance, as long as the
controls of it.
board's comfortable with that assurance, we can stay in here. If the board has any discomfort with that assurance, we're happy to move down to the other room.
I'm good
I
if
think
you
we
all
are.
are, okay.
All right, so we'll entertain a motion to enter closed session.
Madam Chair, I make a motion, the board will enter closed session to prevent the disclosure of confidential information pursuant to General Statute 143-318.11, A1, A6, 20 USC 1232G, and General Statute 115C-319, and to consult with the board attorney and preserve the attorney-client privilege pursuant to General Statute 143-318.11A3.
Second.
The motion has been made and seconded. All those in favor?
Aye.
Opposed? All right, motion carries. The board will enter closed session, and I do not know what time we will actually return to open session. Thank you.
your time.
Okay. We're now called back to order this open session of the Moore County Board of Education. We are now ready to move to items listed under number 4, board action.
Yeah, Madam Chair, I appreciate on behalf of legal counsel and myself, I appreciate the board's engagement on the proposed deed restriction for sale of the Southern Pines Primary School property. At this point, the superintendent withdraws his recommendation, and happy to accommodate the board's interest at this time.
Madam Chair, I move that we table this item for a future date, and then you can put it on whatever.
Not to put words in the mouth of legal counsel, but I think that the superintendent legal counsel be prepared to bring back a recommendation at your meeting on Monday.
Okay.
That'll work.
All right, is there a second?
Second.
All right, so the motion to table until our next business meeting has been made by Mr. Dennison, seconded by Ms. Thompson. Unless there is further discussion, all those in favor?
Aye.
Opposed? All right, the motion carries 7-0. All right, we now move to item 4B, locations of future board meetings. This is an item that Mr. Levy asked to have placed here. So, Mr. Levy, would you like to?
Yes.
Begin with that
We have suspended the change of board meetings to, talking about especially our business meetings. Normally, at least the past few, we've had them out in various schools so as to accommodate parents living around there, people, also a larger room so that people who have interest can come to the board meetings and comment and the like. I do understand that there has been this concern, and for that reason, we've had it here at the central office. I see no reason at this time why we shouldn't resume having our board meetings. I would suggest Union Pines, but I would leave that to the chair and the superintendent to choose a place which has an auditorium and that can accommodate us, so as to allow the most people to come in. I do note that at our last business meeting, there were a number of people who were very upset because they had to remain outside. I think someone said there were 40 or 50 or something like that. I also do note that in the case where the news media has been reporting from Loudoun County, Virginia, where they've had some people who are pretty upset over things, they had it in a large auditorium. And there was no violence or anything such as that. So my proposal would be that we have our next week's board meeting at Union Pines or at another school which has an auditorium or a facility that can handle large crowds.
So you're putting that in the form of a motion?
I am.
Is there a second?
Second.
All right, the motion has been made and seconded that next week's board meeting be scheduled for Union Pines High School. Is there discussion? All right, seeing none. Mr. Henson?
Yeah, I have a couple observations. One is, we should do everything in our power to encourage maximum participation in our meetings, good, bad, or indifferent. And I'm unclear as to what possible objections could be made for having the meeting in an auditorium. I've heard 2 objections since I've been on the Board of Education. I've heard 2 objections to having meetings in larger spaces, such as an auditorium or a gymnasium. The first objection was it puts a burden on the classified staff because they have to set up the sound system. And it was made to sound onerous, like it took hundreds, I'm exaggerating, of course, it took lots of man hours, and the classified staff had more important things to do than set up a sound system just so we could have a board meeting. So I've also pointed out that 3 times in the last month and a half, we've set up a sound system so that we didn't have to sit 20 feet away in our chairs. So I'm unclear how that was ever an excuse not to have board meetings in auditoriums, because the fact of the matter is a classified staff member set up this audio system in our own boardroom. So that was one excuse that I've heard. Then the second excuse I've heard is this threat that really has not been made public yet for the public to judge as to whether it's a threat or not. My feelings on that are very clear. Law enforcement has said that the threat doesn't rise to a chargeable offense. Moore County Schools themselves have said it doesn't pose any threat to faculty, staff, students. In fact, I'm not sure who the threat's to, but my point is this. Right here, it says that due to the advice of the chief of Moore County Police, the superintendent's going to recommend that we not waive the policy. Well, first of all, I'm unclear how an auditorium or a gymnasium is somehow less secure than these board meetings. They both have 2 entrances. There's a front entrance and there's a back entrance. And if they feel there's a need for a metal detector, that metal detector can be put anywhere. But more importantly, this board has not heard from Chief Fry. And I'm unclear why we haven't heard from Chief Fry. Everyone else from the senior staff comes out here and we ask them questions. But Chief Fry has not been made available to us, and I would like to talk to Chief Fry and ask him specific questions as to why, say, the Union Pines Auditorium would be less ideal than this meeting place. And I'm unclear why Chief Fry has not been made available to us.
Thank you. Are there any further comments or discussion? All right, seeing none, then we can proceed to vote. All those in favor of the motion to move next Monday's board meeting to Union Pines High School, say aye.
Aye.
Opposed? Aye. The motion fails 4-3. All right, we'll now proceed to consider the draft of the school board agenda for November 8th. Item 2A must be action because we'll be voting on the mask requirement. Item B, action or consent?
I said consent.
Consent?
Well, the mask item?
No, that's action.
Yeah, where are you? I'm
The
sorry.
second one is the speech language pathology services, can be consent. The original budget, item C, consent. The budget calendar, consent. The second reading of new and revised policies,
Probably an action, right?
or possibly even consent, unless someone has,
No, it's action, because I believe the intention is for us to maybe take 1 or 2 out, so I think if we put it for action.
well, I think.
Otherwise it
two were
passed.
Two were pulled already.
Yeah,
from-
we'll pull those.
Oh, so
Those
those
are
are gonna be
pulled.
pulled beforehand?
Mhm.
Yeah, our direction was that we would pull those 2 unless the
Yeah.
board
Beforehand,
advises
okay.
otherwise. yes.
So it
I
continues
understood
with
that to be the
consent.
board's consensus.
And then, the resolution from Mr. Levy would be an action item. All right. Item A will be action. Items B, C, D, and E will be consent. Item F would be action. All right.
And Madam Chair, item 4A,
Item
would that not be,
4A,
would be
that
board
we
action as
table.
well?
For
4A, that's true. Yes, but that will be added on as an action item. All right, we are now ready to remove to reports, information, and discussion. I see Mr. Barath has arrived back in the room. Dr. Grimacy, do you want to start him off?
Are you suggesting, Madam Chairman, that I introduce Mr. Barath?
Sure, we don't know who he is.
Ladies and gentlemen, Mr. John Barath. For all three of these items, we have more of a report on the Aberdeen Primary and Aberdeen Elementary. We've got Southern Pines Primary on there. John, the board has discussed that in great detail in closed session. Really, is there, I'll just see what it is you have to say on that. I can't recall that there was anything that you needed to add there. Revision of our plan, per the board's discussion last month, we're bringing back a proposed approach to modernization of the 6 elementary schools with some further clarification on the financing and what the limitations of that are as we currently stand. And then also, at your request over multiple meetings since the summer, we're going to provide you with a platform today for you to think about beginning the process of evaluating all your school construction needs. No decision is imminent on this, but we'll have some suggestions for you today. Provide a lot of resources today that you'll have some time to digest. And with that, John, I'm just going to leave it to you and the board, and I'll chime in as needed.
Thank you, Dr. Grimsey. Good afternoon, Chair Carter and board members. So the first item, real simple one. There's been a lot of questions asked along the process of disposal of properties. Exactly what are the dates that we need to pay attention to? When is the due diligence going to end? And when will these properties close? So this executive summary is really just to provide you and the public and everyone with those dates of information as they currently stand. So the old Aberdeen Primary School, the due diligence is going to end in 2 days on that one, with a closing on November 23rd. The old Aberdeen Elementary, the due diligence and the closing, as the board will recall, that was a condition of the purchase contract, would occur on the same day, and that would be December 20th. The old Southern Pines Primary, as approved in the current contract to purchase, the due diligence period would conclude on December 20th, with the closing December 30th. And so I will keep the board informed of progress on these as we continue to work with the buyers to make sure all documentations and other elements are set up in place for them to assume the ownership of the properties upon closing.
John, if you would, Mr. Hensley's probably chomping at the bit to ask this question, but if you don't mind, since the staff still has the floor here, with the due diligence period for Aberdeen Primary ending this Wednesday, if they don't meet that deadline, what can the board expect from you and I next Monday, if at all, or would that be a next month issue?
Or more properly, or more to the point, I should say, do we have any information, one way or another, whether they're going to follow through or not follow through on Aberdeen
Okay.
Primary?
It's a good question.
Two different questions. Let me just go in order of them. The first is at the conclusion of the due diligence, it just means that the earnest money they put down cannot be refunded to them should they discover anything that was not made present to them when they signed the contract. So that's a date that the earnest money becomes ours and at risk for them. The second part of that question is I have had conversations last week with the buyer and have not received any indication they do not intend to proceed with this. As a matter of fact, this morning I had a conversation with the town of Aberdeen as they are getting their process and documents in place to do a change of zoning use for that property. So they appear to be moving forward in getting all their ducks in a row to get to the closing.
And remind us, John, how much is the earnest money that the board expects for?
The earnest money by law was 5% of their offer price. I haven't, not doing the math in my head here.
In the 30s.
$473,100.
That's what I was thinking.
It's about 25, 28,000-ish, in that range.
Okay, all right, thank you.
That's interesting. So the town of Aberdeen is changing the zoning of the old primary school site?
They are not done anything yet. There's planning and the buyer have been working together on the process and everything that's required to submit for final reviews of that to do it. So the intent appears to be upon closing to change the use.
Okay, and then on the third bullet there, Southern Pines Primary, that's actually what my question was about. So those dates there, those are the dates upon signing of the contract, correct?
Yes.
And the contract has not been signed yet?
No, the contracts for all three of these have been executed.
the Southern Pines primary has been executed?
Yes.
Oh, I thought that was pending our approval of the deed.
According to the October 12th and preceding meeting, don't have the date in my head, the action the board took was to approve the contract, and then the request was to bring back the deed and including the preservation agreement for board review.
Hmm.
I would leave the rest of that to legal counsel.
Yeah.
That was just our
Yeah.
understanding when we were preparing.
That was one of the
for
points
other
of
item.
confusion that we had. Can't get into a lot of details about closed session, but I think it's fair to say that was a point of confusion during closed session. It needs to be cleared up before next Monday.
Well, we probably ought to go back into closed session then, because I've got serious questions.
Do we have, let me ask, is there a signed buy-sell agreement?
Yes, there is.
That's what,
Does
that's
it
not my
signed and
understanding.
Fully executed, and we do not have an indemnity agreement?
We have the indemnification agreement in place and the executed contract signed by all parties is in place.
And I'm fairly sure that at our board meeting, that there was a motion with majority approval that we accept the contract and follow-up would be done with the deed, with wordings within the deed. Now, we can go back and
That
look
was,
at that.
that was my understanding as we discussed it during closed session today. What Ms. O'Keefe indicated did not, I needed to have validation of what the minutes were on the exact motion, and that's one of the things that I wanted to clarify in these make sure the board was clarified on the next few days.
No, I
We
think
can
I
go back
asked,
and look at it,
I
but-
think in open session, I asked, the last open session before we voted, I think I asked, does this mean that there's no contract until the deed of trust is reviewed and approved? And I was told that's correct. So this, I'm very, well, I'm surprised and shocked to hear that the contract's signed, because it was my understanding at the last meeting that no action was going to be taken until we reviewed the deed of trust. And now I'm learning that a contract was signed. I don't know. I guess we're going to have to,
It was my intention to make sure that that was made clear. I haven't had a chance to talk to Ms. O'Keefe on that. but
Other
I-
board members,
I remember voting yes to them going through with it, but I do remember us saying something about the deed and then the other contingency that we
yeah,
had.
that we would follow back up
That
with
we
the
would follow,
deed.
make sure that we had that
And we, yeah.
different, situation. I don't know if we're allowed to talk.
And I may not have it fully recalled, but I believe it also had to do with the response to the question that you made, Ms. Transley, was that there would not be a closing or transfer of anything until that was approved and that legal had agreed with it. I apologize for not remembering all the wording, but I believe there might have been something along those lines in response, but we can definitely look into it and provide the board with the information.
I think my exact question, and I'm doing this from memory and paraphrasing, is are we contractually obligated until the deed of trust is approved? And the answer was no.
Yeah, I think that there was confusion in the closed session.
So
I think she could have-
I guess we need to see the contract, and there should be a contingency in there saying it's contingent upon the board
I think
approval
I
of the
can-
deed of trust.
I think I can answer part of it. She did say, can I say what she said in open session?
I don't know.
That's one of the problems.
Yeah.
I better not. But let me
Hold on,
see if I can
Mr. Levy,
phrase it.
hold on a second. Does the contract have a contingency in it saying that it's contingent upon the board's approval of the deed of trust?
Okay, let me try to answer that, because I think I know the answer. And I'm not gonna say where I got the answer. I think there is something called a condition precedent. And I think that I know what a condition precedent is. And a condition precedent says that you must have certain things done before the contract is valid. And I think that is the position of the board, but I think we need to ask council for clarification as to do this thing called a condition precedent. So I'm trying to dance around any information that we may have learned from council.
Okay, let me just read from the draft minutes. These are not official. These are the draft minutes. The original motion to approve the proposed contract for sale of the old Southern Pines Primary School property to the Southern Pines Land and Housing Trust as presented, with additional deed restrictions drafted by the board attorney and subject to approval of the deed restrictions by the board before closing. And that's the way I remember it. So essentially, yeah, we approve the contract, but we need to approve the deed restriction before closing.
So is that contingency enumerated in the purchase contract as a contingency?
I don't believe it is, but we need to certify that with legal counsel.
Because if we didn't approve it, would it still go through? If we didn't approve the deed?
It says, subject to approval of the deed restrictions by the
then it would be
board before closing.
Well, hopefully it's in the contract as a contingency. Hopefully our legal counsel put it in the contract as a contingency because that's what our motion required.
The contract, yeah, and without legal counsel sitting
Right,
here right
understand,
now, we could be here all afternoon trying to guess what's on legal counsel's mind. What I would suggest is Mr. Ramey will be back in town tomorrow, probably take a day or two before he gets focused in on us. Probably by Thursday or Friday, we'll have something we can put out and certainly be in a good position by Monday. But that's the reason why I hesitated during closed session, because I knew the language was of this nature, but exactly where that line is to answer your question, I can't.
Okay.
And we also need Dr. Grimacy to learn whether the indemnity agreement is a condition precedent to the validity of the buy-sell contract. That's real sort of technical stuff, but I think you understand what I'm saying.
Well, Mr. Ramey, one of the things he'll do when he gets back is view this video, and he will listen to you say it yourself.
Okay, all right.
I will.
That's fair.
There is no way you want me to translate that for you.
That's-
So we're going to have
that's
him just
fair.
listen to what you just said
That's fair.
and come back with an answer. So
Right.
Dr. Grimacy, if you could have a copy of the purchase contract, the executed purchase contract sent. I'd like a
Yes,
copy, probably
absolutely.
all the members of the board.
Absolutely. Was that
Ms.
wasn't-
Potter has that.
Yeah.
By the way, one of the things I hated in law school were conditions precedent, and I hope we don't get into conditions subsequent. You know, just-
All right, are there other questions concerning the disposal of these three properties at this point?
You said that Aberdeen Primary is due diligence is when?
2
Due
days.
diligence concludes
2
Wednesday.
days from now.
Mhm.
Okay.
I do want to thank the board for your patience. Mr. Ramey had a lot of hesitation about putting this out for board action today. He felt it was a little premature, and I just felt it would be in everybody's best interest if you had the opportunity to look at it without everything else going on at a regular board meeting. I think now he was right and I was wrong, so we're gonna, but this is good, because you've been able to raise some questions that by the time you take action on it Monday, we'll have the opportunity to really have a thoughtful process.
All right, then let's move on to item 5B, the revised plan for modernization of 6 elementary school gymnasiums. And we're back to Mr. Barat.
Thank you, Chair Carter. As the board will recall, at the last work session, I provided an update on all the capital projects. But also important to that was I included a description of all the impacts from the rising costs of construction on the projects. It is also worth bringing to the attention of the board, one of the discussions that came out of that was the impact that would have to the plan for the supplanted funds from the ESSER projects with combination from the county on the bond premium funds to the completion of modernization of 6 old gymnasiums. The cost of those projects has increased as a result of the presentation that I gave in October from a projected cost of $12.69 million to just over $17.5 million. As you will see on the chart in the executive summary, the flow of funding for these projects was contingent on those two aspects, one, the county bond premiums, and the other, the supplanted funds. The county bond premium amount has remained unchanged. It's always been fixed at just over $8.6 million. The supplanted funds has changed and is reduced. Previously, we had anticipated to be approximately $5 million. The impact of the capital projects to be completed had reduced that availability amount down to $3 million. The combined available revenue is just over $11.6 million. Again, the cost is just over $17.5 million, resulting in a projected need of additional funds to complete the projects of $5.9 million. At the board's request from the work session, I was asked to bring back a best case approach to completing as many of these school modernizations as possible in a quick period of time. The funds are readily available from the county of the bond premium, while it will take the duration of the ESSER spending plan period in capital projects of approximately just under 3 years to grow to a supplant fund level of $3 million. The intent is that we can initiate up to 3 projects within the next 6 to 8 months. The balance of the county bond premium funds would then be combined with other accrued savings to allow, at best case, completion of another project. Following that, there is a need for the final 1 or 2 projects to have an alternative source of funding. You scroll to this sheet.
Yeah, thank you.
You will see how that spending is accrued, or is accomplished over the duration of the projects. The running balance starting, again, from the previous page at just over 11.6 million, and then the revised cost estimates for each of the modernization projects on the left. Cameron, High Falls, and Westmore Elementary School modernizations can be done that will result in a combined cost, in a combined cost of approximately $8 million. That leaves $3.6 million to be applied to the next project, potentially Sandhills Farm Life, where the balance at that time will be reduced to just under $500,000. Supplemental funding is required for the completion of Bass Lakeview and Carthage Elementary projects. We do recommend that these projects be included in eventual discussions with the county commissioners at the time when the district seeks the consideration of bond premium funds to support the costs of the first 3 projects. Upon consensus of the board, the superintendent's staff will communicate with the county manager to determine the next steps associated with the financial support for the plan. We will also begin the process of soliciting qualifications from sources that can provide design and engineering services for these projects. We will also provide the board with a detailed and refined timetable for the execution of this, including the design, bidding, and construction periods. It's a lot of information, and give you a moment to digest it, and I'm available to respond to any questions you may have.
Thank you. It's really, I mean, I know we're coming up short on money, but it's still good news to know that we might be able to forge ahead and get started on the first 3 within the very near future. Disappointing that costs continue to rise.
That $500,000, I'm sure, is gonna get eaten up in inflation. So how soon can we start these projects? I mean, you know, let's get it done already. Or do we need board resolutions?
Yeah, and
What do we
that's-
need?
Yeah, that's what I was gonna ask. Is our next step to accept Mr. Baraf's presentation of where we need to prioritize based upon the funds we have available, and then proceed to get bond premium from the county commissioners, and as Mr. Levy just said, let's proceed, let's move on.
And that is what is summarized here, and to Mr. Levy answer the question, approximately 6 to 8 months to have documents ready to solicit for bids. We need to first go through the process as outlined to speak with the county on allocating the funds, go through a request for qualifications process for design and engineering, bring their contract to the board for approval, and then proceed with that work with haste.
Dr. Grimacy, our approach to the county commissioners then would be the next thing up, right?
Yes, ma'am, it would be. I think the next step would be, well, first I'll engage with the county manager, organize a meeting between the two boards' liaisons, and deal with this on two levels. One would be the commissioner's temperament with respect to releasing the bond premium money upfront without us matching it with any of our ESSER supplant money, which I'm inclined to think will be received well on that. And then second would be to see if the commissioners, what their temperament is relative to the projects later down the line in terms of what interest they might have in making sure that Farm Life and Bass Lakeview are addressed. I think the reason why Carthage, John was not specific about this, but I think that our constituents and patrons in Carthage are going to just make sure that they understand why Carthage is at the bottom of the list. Mr. Hensley once asked me, or Mr. Levy asked me, if you had to pick one, which one would it be? And I said, well, it would be Carthage because of some of the engineering issues. The cost of Carthage is so high that it would actually bump out two other projects. So if we front-loaded it, that two other projects would not get done. The other thing is that in the next presentation that Mr. Brath offers, Carthage is among, what we think will be among the top priorities for perhaps replacement. And so sitting here today, as of today, and maybe for the next couple of months, Carthage is, of the 6 projects, Carthage is the one that's a little bit more fluid, and it may have a separate remedy that would be related to a broader investment approach. So that's for those that are listening from Carthage or might listen to this later, that's kind of a placeholder right now for Carthage, and it would be helpful. I think the commissioners and Mr. Vest would have some interest in just talking about that and seeing where we're going with the next part of this presentation. So yes, Madam Chair, what Mr. Brath and I would do next is work with our liaisons and the commissioners' liaisons, get together, talk about next steps, and then bring back an affirmative recommendation. I'm guessing we could, it's very reasonable that by the board's December work session, we could come back with recommendation for qualifications on design and engineering no later than January and maybe as early as December.
No later than January, sir.
Okay.
The process includes a required posting duration in a public, widely circulated paper, the opportunity. Then you have all the parameters you have to define as part of that they must respond to.
Okay.
You must have a committee assemble and review, identify, interview, and then recommend to the board.
And that's just design and engineering, that's not construction.
Correct.
So we'll get on that, Madam Chair. So we have we basically have 2 tasks we have to really be aggressive about, and that's engaging representatives from the school board and the county commissioners together, and then getting about the business of requesting qualifications, given that seems to be the board's direction.
I think we've already had consensus that we were ready to proceed.
We're ready.
Would you like this to be a board action next Monday?
Yeah.
All right.
For sure.
I'm good with it.
Okay.
Anyone else?
If there's no questions to the contrary, Mr. Brath will work up an executive summary as a board action item and include that on the agenda.
All right, thank you.
Yes, ma'am.
All right, let's move on to another biggie. Mr. Barath. Item 4C, the plan for determining the next generation of capital construction needs.
That is a plan, Madam Chair,
A
not
plan.
not the plan. Right.
The plan, okay, well, we've had a plan already as well, and of course, we all know that the list of priorities within our schools was extensive, and it is a pleasure to note that we've made great headway in accomplishing quite a few of the capital issues that had existed, and thanks to some of our ESSER funds, we will continue to make quite a bit of headway in that large list. I, for one, am appreciative of the fact that we have a 20-year plan, which does enable us to plan ahead for just the routine maintenance and replacement of things that simply live out their life, and that we're not going to be continually playing catch-up as we proceed through. So we appreciate you walking us through this plan and getting us in the right direction.
Well, thank you, Chair Carter, and I hope so. Just bringing up a topic, it's been a while since the board has given itself the opportunity to begin thinking about that. We've had a lot of board members express interest in it, and so Dr. Grimacy and I felt that it was appropriate to introduce it to the board so the board could begin working towards what they deemed the best plan and process would be. So it's a very exciting time with the opening of the new Pinehurst Elementary School. That fulfilled the commitment that was made by the Board of Education, also funding commitment by the county commissioners and the Moore County voters in both 2017, 2018 for the projects. Now, this was also 4 elementary schools: McDeeds Creek, Aberdeen, Southern Pines, and Pinehurst, new school and replacements, as well as the large addition at Northmore High School. So the original master facility plan for the projects that originated back in October of 2015 and then modified in October of 2017 to reflect the newest order of the projects, half of those projects are now complete. Remaining on that list is increasing capacity in the modernization of Pinecrest High School and of Union Pines High School, a new middle school in Southern Moore County, the Advanced Career Center, and increasing capacity at the West Pine Elementary School. Throughout these past years, also what has come up and is not included in the final version of the master plan the board had approved in 2017 were needs such as the modernization of the gyms, which we just talked about, the modernization or replacement of Carthage Elementary School, and the modernization of the Community Learning Center at Pinckney, specifically including the alternative learning spaces and the IT support facilities. Since then, emergent needs include, but are not limited to these, the expansion of Cranes Creek Middle School to its core capacity. To remind the board what that means, Cranes Creek Middle School was originally built with a core capacity to support more classrooms than they built at that time. They built fewer classrooms at that time, but left the core large enough to accommodate more. The modernization, expansion, or replacement of West End Elementary School. The modernization and expansion of Cameron Elementary School to its core capacity. The modernization of Alice Middle School and the expansion of the core and classroom capacities at Vast Lakeview in response to their projected growth of enrollment. Thank you for keeping up with me. So as you can see, there is a need to revisit and provide a structured process in which to evaluate the range of school construction needs and then establish a plan to address these, which would become the next generation of projects. Over the course of the past several months, board members have expressed an interest, as we talked about earlier, as most recently has come to light, has been the needs of Carthage Elementary School and brought to the forefront by Carthage Town Council and their school planning section. So now we'd recommend that the school board consider a process by which to review, assess, and revise a master facility plan in conjunction with the capital needs at the existing schools. This is the plan that Chair Carter referred to in the introduction. At this time, this work also presents the opportunity to update the integrated planning for school and community study and the land use study that was completed in 2017 and presented by ORED at NC State. When those were first presented, the best practice of assessment was to include an update to the board 3 to 4 year intervals. This process would begin with the request for qualifications for consultants with experience in such areas in guiding the school board process for determination. This consultation would include the updates to the IPSAC and LUS by ORED, It also would involve an engineering survey of all the facilities in the properties to confirm the capital needs, advise of additional needs, and to update and prepare the projected budgets. The consultants would continue to collect data, interview municipal staffs regarding residential and commercial development patterns from since the previous study, the interview of developers on their timetables for build-out of current developments, as well as interviews about forecasted and projected developments. They will use the information to project the growth in all the attendance areas and use that data to develop the recommended master facility plan projects list for the board to consider, an updated schedule for capital improvements at existing schools, and a set of projected funding strategies for all the improvements. It's anticipated that this process will take 6 to 8 months to complete following the hiring and approval of the consultant. We're not going to go open each and every attachment. Don't do that, Charlie. But to give the board and the public the information, this is a historical archive of the documents associated with these topics. It's organized by primary and secondary sources. The primary sources represent the key decision-making points in the school board's construction experience. The secondary sources add the additional details for board members and the public related to the context of those items identified in the primary archival documents. There's a lot of information attached to here. There's also a lot of words here. So this comes to the board as information and really in seeking feedback from the board as to the general intent of a process such as this. And Dr. Grimmett and I are available to respond to any questions you have about any of this.
John, if you could, before we miss the opportunity, let's advise the board, the Carthage Town Council has had a meeting, they've been advertising it pretty liberally, where you and I will give essentially the same presentation we've given in 2 previous meetings that we've tried to keep the board up to date on. But could we just go ahead for the record, just mention that right now so that everybody knows what time, where, and when, and
Yes, I just wanted to pull it up the time so I
Okay.
didn't misstate the time.
yeah, just so everybody knows.
And as Dr. Grimmett said, it's the same presentation. It'll be presented on November 9th, next week, Tuesday, at 6:30, and the presentation will be held at the Board of Commissioners meeting room at the Historical Courthouse. So the venue will not be at the Town of Carthage Town Hall. It'll be at the Board of Commissioners meeting room.
It started with their education committee, and then they brought in some other people to the second time, and then this time they wanted the whole town council there for this one. But it becomes a public meeting, and so with that, we just wanted to make sure you all were aware of that. There'll be a few new details, but for the most part, it's the same presentation that we've reported to the board about previously.
It will be, yes, sir.
Madam Chair, we're available to facilitate a conversation. Staff doesn't really, we just felt like we needed to get everything out in front of you that we could think of, and then just see what your interest might be.
Thank you. All right, Mr. Levy.
Yeah, just, I heard the buzzword consultants, and that's really something I don't really love, but I better ask this question. How much money for the consultants?
That would typically be dictated by higher scope of work, but we anticipate this to be in the range of between 20 to 40,000, depending on the refinement of scope of services that we would be expecting out of them. In a complete detail that would be presented to the board before the board took any action on the consultants.
And one other thing that I will just let you know, my personal preference, and I don't know how many people on the board share this. I've always believed that we need to build out many more smaller schools, not enlarge our current schools into larger ones. And I know that there is an economy of scale, and I know that the idea would be the larger your school, supposedly the more students you can jam in there at less of a cost. But I just really and truly believe that this whole idea of expanding large schools into larger schools So for instance, expanding Pinecrest rather than building a new high school, or expanding McDeeds Creek rather than building a new school, does a disservice to a lot of our students who do much better in smaller schools with smaller class sizes and fewer assistant principals.
And shorter travel times,
And
and
shorter
true
travel.
community schools.
Right.
I think you can probably get a good feel from staff on their information on the size, like elementary school, size of middle school, that work really well. It gives you a good idea. But John, something else you might do, I think will help, is particularly the 3 new board members, is send them the last ORED report that shows how detailed they are, the birth rate, all the new developments going up, the whole kit and caboodle, all pages. It's an eye-opening thing. to
I
see.
believe it's there,
was
Mr.
gonna
Dennison.
say, I
Yeah,
believe
we've,
it's
the whole purpose of
Oh,
all
is it
these
up there?
resources.
Okay.
Yeah.
Yeah,
And
Okay.
our goal was not to, our goal wasn't to overwhelm the board today.
Yeah.
We just wanted to create a one-stop shop for
Yeah.
all the past resources so that the board could evaluate its options on process and to kind of, well, whatever the board wants to do. But that information that you're referencing is
I
One
didn't
of those
see it.
links.
among these, yeah.
To just draw your attention to it, since the question came up, it's under the secondary archival documents dated January 16th, 2018.
Okay.
Staff is not making a case today. We're
Right.
following up on months of inquiries and conversations by individual board members, so there's no rush. But we did know that with the decision about the 6 gyms, we were starting to sort of find our way into this discussion about Carthage, because the Carthage gym is on that list. And it might be helpful to be mindful of the bigger picture before a final decision is made about that particular expense item.
And I think in 22, 23 now, we'll find out how our redistricting plan worked out. That'll take effect at 22, 23.
No, sir, that's this year, and we've
Okay, we
got
can
several
look at it
other,
now.
we have several other reports and analyses that need to happen in November before we're in a position. But as of now, this is the first year that we've had in anybody's memory. We're the only 2 schools that we have that are above core capacity by any statistical significance are Pinecrest and Union Pines.
Right.
And by the way, that, even without a consultant, especially I want to tell you, the public really doesn't understand a lot about why we abandoned, why the school board abandoned the Career Center.
We didn't
Okay.
abandon it.
No.
We
well,
didn't abandon it. It was
well,
the county commissioners.
It was, no, I understand. It was a preference of the board, and then the board decided, whichever way, whatever, it decided to go in a different direction. But in terms of the public, because I listen to the public all the time, they're still concerned about dealing with a new high school, which really could mean that advanced career center, could mean some high school in between Union Pines and Pinecrest. And unfortunately, it's the most expensive option that there is, because a high school is the most expensive thing to build. But, it still is what is staring us in the face, and I think politically, we need to prepare to go to the county commissioners and find some way to get this new high school built, somehow, some way. And that should eat up a lot of money, and may even, and that along with Carthage Elementary, those 2 projects, that'll eat up a lot of money and a lot of effort. But those are really the most pressing things that we need to get done.
Just for the purpose of illustration, Mr. Levy, would you then advocate closing Pinecrest and Union Pines?
Closing? What are you talking about?
No, well, it just really, no, I'm not being cute. So you would keep those open and add another high school?
Oh, yes.
Okay.
Yes,
And so the dilemma then, and that's the reason why you have to take a bit of a comprehensive approach to this, is that Union Pines and Pinecrest still need significant investment in terms of modernization. And so what you have to do is that by getting them all together, you don't need to spend a lot of time. We're talking, 6 months to have this conversation, or maybe 8 months to have this conversation. Very important you do a comprehensive needs assessment, look at everything, so that you know what your trade-offs are. If you decide to go after one big, expensive project, what is it that you're not gonna be able to do, and for how long can you put that off? I'm speaking only rhetorically at this point. Taking a more comprehensive approach is gonna put the full menu out there so that all constituencies can see, you can let everybody know that you're evaluating all the priorities, and you may just settle exactly where you're at right now, but you're gonna want to, by whatever means you do, and this will happen beyond my tenure, so I have no benefit from this whatsoever, but my advice would be, take some months here to do some sort of comprehensive review of all of your priorities, and then see where you settle out. We may be exactly where it is that you want us to be, but right now it's premature because there's just a lot of, a lot of needs that you have here that you might want to inform yourself of before you draw final
Well,
conclusions.
I don't doubt more information is always best, but the one thing I want to try to caution against is spending a lot of time, energy, and money on a lot of consultants just while inflation is eating us alive with the rise in costs. And that's a big concern of mine. And I certainly, want to preserve our money for hiring teachers as opposed to hiring consultants. And that's my concern.
Just as an example, I think the last plan, when we made the decision on what we were gonna do first for the bond, the addition, or the changes to Pinecrest High School alone were over $36 million, just for information. And it'll all be up there.
Other comments or questions? I have to say, I have some reservations about taking the next step and hiring consultants until we have a new superintendent in-house. And that's somewhat because I'd like to see the goals and objectives that new person might have as they assume a leadership role within the county. On the other hand, it doesn't mean that we can ignore the things that still need to be done. So, Mr. Hensley?
I would just say that as we start down this venture, the important thing is that we set the expectations of these communities and these people, and that they understand, what our left and right lateral limits are. And we'll develop those over time. I've communicated some of those, but if the community wants to do something that's going to significantly add to the cost of a school, then they're going to pay the delta, as an example. We just have to set ground rules, and we have to set left and right lateral limits, and we need to set their expectations.
All right, any further comments or questions? All right, then seeing none, Mr. Barath, thank you very much.
Thank you.
All right, we are now on down to board comments. Mr. Holmes?
I don't have any.
Ms. Caldwell?
I have, I don't know if it's necessarily a comment of sorts, but there's been a lot of talk about November 12th being a teacher day in other counties. And I wasn't sure if that was something that you and maybe Dr. Grimacy have talked about as something that we're gonna do here for Moore County.
It's been a very popular conversation lately.
Very much.
And I'd say I've seen a couple of media reports where WRAL had a big map, and now tonight, this school board's meeting and discussing this wellness day, they're calling it.
Yes.
It means different things in different school districts. We've looked carefully at that. I'd say the idea of a day off for everybody is not out of the question. It's just how you do it, okay? And so we have not allowed ourselves to rush into that issue, just simply to rush into that issue. If we're going to have a calendar change, we're going to have a thoughtful approach to that. If you guys want me to, I can go through the details of the things that you need to consider with that. What we are going to do is there's going to be a meeting of the faculty calendar committee with Dr. Metcalf, and we're going to look at the parameters of that and see what the calendar committee might recommend to the board as far as of some sort of a holiday that fits all the parameters. One expectation that I have is this use of bank time, okay? It seems very tempting. It's there for emergency purposes. It's not something that you want to be quick to use. Here's the first immediate problem with bank time. Bus drivers, child nutrition workers, and other classified employees lose pay when you do that, because they only get paid when they drive the buses, or they only get paid when they serve the meals. So effectively, what you're doing is you're defaulting to the hours, the minimum hours that you're required to fulfill, and you're doing that at the expense of the number of days of instruction that you have, which means you're going to take away a day where drivers are driving buses and child nutrition workers are serving meals. Now, we have to do that sometimes. If we have an emergency, we have to do that, and I think our bus drivers and our child nutrition workers understand that. But when we decide that we're going to have X number of classifications who have, because they've worked hard and they've sacrificed, they get a paid day off, but other employees that also have sacrificed and risen to the occasion, and they lose one of their paid days, I think we owe it to those individuals to just take our time and just take a breath and have a good plan to bring back to the school board. So we may have a recommendation for you at some point with that, but when we do it, we want to make sure that it's very thoughtful. Now, I add one more thing. This movement resulted in a memorandum from the state superintendent at the end of last week that was very pointed in reminding superintendents of what the rules are for doing this sort of thing, okay? And that's because some districts have moved a little too fast, all right? And so I think that was a message from the state superintendent. Look, we're not opposed to this idea, but you need to make sure you're forthright with your school boards about the various requirements you have to meet in order to do that. You can't just arbitrarily give everybody the day off. You've got to be thoughtful about that. So we don't have a recommendation this time, and if we have one, we'll have one. We'll do it, but it'll be one that we can bring to the board with fidelity.
Well, I get a lot of
I
text
know.
messages and calls, so I'm glad it's out there now that people know that.
Yeah,
So-
I get
so I
that.
appreciate that.
I get that too. We've actually tried to see if there were ways that we could accommodate that, but not in time to bring anything to you all this
I
month.
appreciate that. Thank you.
So, this is the first I've heard of this, but would this be a day that would not be made up? This would just be a day that we subtracted from our children being in school?
Good question, Mr. Hensley. It different, that's why I said different districts have taken different approaches. The model that I heard being discussed among some of our employees was that we could just use this bank time. And we've got X number of, since we are in school every day, an amount of time that exceeds the minimum required to meet our hours requirement for the year, we bank time that we can use in the event of a hurricane, or we have a snowy winter and we want to have some options later in the year other than going into the summer. That's what bank time is for. It's for emergencies. And in this particular case, some other districts are using that bank time to do that. So in effect, they are cashing in an instructional day when they do that.
Yeah,
yes.
so I'll tell you my opinion on that. You could guess, under no circumstances, the superintendent mentioned, the inequities, that's the wrong term, but the inequities between, classified staff and people would get paid and people wouldn't get paid. Well, an even stronger thing is it sends the wrong message to our children. Is your education is so important that we're just going to subtract a day off because people want to go on a day on vacation. We're in the education business. I find that unacceptable. But I'm just one person. But I cannot believe, especially ask any business owner, the work ethic of many of the current generation that's entering the workforce, and it's getting poor. and granted, that's a wide net, and we want to reinforce that poor work ethic by saying, oh, well, gosh, your education is so unimportant that we'd rather take a day off than spend a day in school that was previously scheduled. And that's the message that we would be sending to our children and their parents, and I just think that's unacceptable.
Yeah, let me add, the state provides, in the required workdays for the year, districts are afforded what are called optional workdays. And so teachers are paid on optional workdays, and classified employees are paid on optional workdays where they can choose to use their personal leave or work on that day. And so I think there's a remedy somewhere in that flexibility that we have, but we want to be thoughtful about that.
But our
and
children are
bring
not
that.
learning on that day. Regardless
sir.
of who gets
No.
paid or who doesn't
No, on
get
those-
paid, the most
no.
important thing is our children who
No,
we're
sir.
here to
No, they're
educate
not.
are not getting educated.
Yeah,
Well, they're not getting educated. I don't care who gets paid or not paid.
Yeah.
The important thing is our children are not getting educated, and we're sending a message to our children, our parents, that all of a sudden we need a day off that's an unscheduled day off that's more important than their child's education. And you think we've had parents out here before, you'll have half the county out here. You'll have half a county that's on vacation, the other half will be out here, why are my kids not in school?
Well, if this is your response to me not recommending it, I can imagine what your recommendation, your response to me if I do recommend it.
So the other,
I'm not recommending it.
The other point that's germane is what about the parents who don't have that Friday off, that all of a sudden they have to pay for daycare?
And we've already heard from them.
Oh,
And it's one of the reasons why I'm not recommending it yet, at least yet. But if we do it, I'll have the calendar committee can look at optional workdays where students are already on holiday that day. And if they want to rearrange, those are already scheduled. If they want to rearrange those and give that some thought. But right now, that's just going to go to the calendar. I'm just responding to Ms. Caldwell. And I knew there was just a lot of chatter about this, so I thought
It'll put to rest.
I thought, put it to rest, but I'm not out of the box opposed to it, but I just see, this all just blew up in the last 3 weeks.
Yeah.
And
I think
that's
Many
not a
counties
good
around.
way to approach it.
I think the number one message is we're in the business of education, and we're gonna educate, not vacation. We want education, not vacation.
Well, and teachers can avoid assigning homework that night before, then kids truly have a day off and they don't create extra work for themselves, and can have that time off as well. Mr. Levy, any comments?
I just, I'm still rather disappointed that we are not going to have our school board meetings in a place that can accommodate all the people who want to attend. Last time, we had, 40 people outside. If you really want to make people disruptive, tell them that they can't participate. Tell them that they can't talk. You know, I read in the Pilot recently that there was one controversial school board meeting where they had over at Union Pines 1,000 people. At least that was what I believe the Pilot reported. 1,000 people at a school board meeting. All we're saying is a couple of hundred ought to be able to be given the right to attend. And I would also hope that people would read my resolution and take a look inside of yourselves to say, do we really favor the First Amendment? Do we really favor the right to petition government for redress of grievances? Do we really trust our people to come here and talk to us in a civil manner? And they have been doing that, and they have been trying to do that. If we constantly tell them, no, you can't come in, no, we're going to leave only about 10, 15 spaces for people to come into our meetings, then people are going to be justifiably angry. You know, we have to, if we're going to teach civic responsibility. We have to have the bravery that it takes for public servants to respect and listen to the First Amendment. My heavens, I don't know how many people have come here and said, Bob Levy, you're this, Bob Levy, you're that. And I sit there and I smile and I listen. And sometimes I learn. But when we exclude people from our meetings, we're doing very much a disservice. So hopefully people will think about that and we'll change our position and make it possible for any person in this county to come here and watch our discussions and come here and look us in the eye and talk about things that they want to talk about. And so that they can observe their government at work.
Thank you. Mr. Dennison?
No comment.
Mr. Hensley? Ms. Thompson?
No, I don't have a comment. I wanted to recognize Dr. Grimacy for the resignation that we received for his retirement, but I know you may have some comments, Madam Chair, so I would just yield to you.
Well, very quickly, let's recognize the elephant in the room.
Yeah.
There we have it.
Well, that's a kind comment.
The one and only Dumbo.
One of my favorite characters. No, we have accepted Dr. Grimacy's request for retirement. I guess I showed him too many pictures of my grandchildren, and he has decided that he must spend a little more time with his delightful duo. We will be addressing the issue of his departure and his celebrating his time within our schools in the future. We'll also be talking more, and I think we will have on next week's agenda discussion about the processes we will employ in order to seek and hire a new superintendent and possible use of an interim superintendent in the process. There will be more to come on that as we proceed in the next few weeks. We will not be letting any grass grow under our feet such that we can proceed on, but we look forward to having Dr. Grimacy's cooperation in the transitional period, and then we'll wish him well when he steps out the door. So with that said,
Madam Chair, move the meeting be adjourned.
A second.
motion by Mr. Dennison, second by Ms. Thompson. Is there any discussion? Seeing none, all those in favor?
Aye.